We extend our warm greetings to you all from the Pacific. As of today, there are 273 confirmed cases of COVID 19 reported in the Pacific: Fiji, French Polynesia, Guam, New Caledonia, CNMI, and PNG. The rest of the Pacific are still free of the coronavirus. We have not been idle. In fact, the Pacific health ministers met more frequently than ever since early 2020. We met once a week to discuss how we can prepare and respond to COVID 19. Each of our countries has unique customs and traditions, but share many characteristics. Relatively small populations dispersed across vast distances. That mean we face many common challenges in dealing with COVID 19. Working in solidarity, we focused on a common framework of health sector preparedness and response plan for the Pacific. We inventoried the capacity of our health systems, including technical capacity on critical preparedness, readiness, and response actions for COVID 19, critical laboratory and medical supplies, personal protective equipment, and worked with partners to address the gaps we could without any delay. It is one of the most challenging tasks we are dealing with in the Pacific, and many of us started to implement border restrictions early on to avoid importation of the virus. In my own country, Nauru, our key challenges are geographical isolation, small healthcare workforce, a small critical care units, and communal living family arrangements that can easily fuel local transmission. For the Pacific, as countries start to implement tighter border restrictions in our region and globally, it became harder to send samples for testing, harder to send critical samples in. We subsequently agreed to form a humanitarian pathway, a mechanism that enabled the provision of medical and humanitarian assistance from regional, international, and development partners in a timely, safe, effective, and equitable manner. Moving forward, our Pacific Island countries are preparing for what is going to be a new normal. We have urgent, unfinished business such as building strong health systems, closing immunization gaps we cannot ignore. And there are emerging issues that demand our attention in the new normal. The COVID 19 pandemic is a global health emergency of unprecedented scale. It poses a real and extreme danger to the health and security of the Pacific people. In this time of crisis, we gather, albeit virtually, with our Pacific family to work in solidarity and with the continued support.
Thank you, Honorable Minister. We invite now Antigua and Barbuda to deliver a regional statement. Honorable Minister, you have the floor.
Director General, Excellencies, ladies and gentlemen, it is my honor to deliver this statement on behalf of the delegations of the Organization of the Eastern Caribbean States and Barbados. The Eastern Caribbean region watched the global pandemic of COVID-19 unfold, and with great concern, particularly because of the high risk of severe disease related to our high burden of chronic and non-communicable diseases. When the first cases were imported, the region took swift and decisive action to contain the spread of the disease, relying on basic public health measures of hygiene, quarantine, detection, contact tracing, isolation, physical distancing, and travel restrictions. Allow me, Mr. President, to pause and recognize the dedication and courage of our healthcare workers who served on the front line, especially our nurses and our doctors. Containment works. All countries in the region were able to flatten the curve. However, the needed response to the public health crisis has resulted in the related unprecedented economic and social crises. International travel restrictions and strict physical distancing protocols have devastated tourism and other economic sectors. On average, tourism contributes over 50% of GDP and nearly 40% of employment across the region. Given the interconnectedness of our economies to countries in Europe and North America, our ability to respond to the pandemic is inextricably linked to the success of measures taken outside our shores. The region's response is further constrained by a fragile macroeconomic climate and high levels of external debt, contraction in donor support, and the threat of natural disasters. We are still recovering from the devastating impact of hurricanes in 2017, and the new hurricane season begins in 2 weeks. Mr. President, to ensure our small states are not left behind, the region calls on global partnership in the spirit of solidarity to address the following needs of COVID-19 and beyond. 1. Access to financing and debt forgiveness to allow the region to effectively address the fallout of the pandemic and to support vulnerable populations, households, and businesses. 2. Continued support of PAHO and WHO to strengthen health systems and support transitioning to appropriate technologies, including digital and telemedicine solutions. 3. Access to currently needed supplies for COVID-19 response and equal access to emerging rapid tests, medicines, vaccines, and technologies. And 4, development of relevant protocols for reopening of the economies, including the hospitality and cruise industry. At this time, Mr. President, we would like to take the opportunity to thank PAHO and several regional agencies in the Caribbean community, including the Caribbean Public Health Agency, CARPHA, the Caribbean Disaster Management Agency, CDEMA, the Implementation Agency for Crime and Security, IMPACT, the Regional Security System, RSS, the University of the West Indies, UWI, for their continued and invaluable support. Mr. President, I thank you.
Thank you, Honorable Minister. We would like to invite Mali. Your Excellency, you have the floor. Your Excellency, we don't hear you. Can you please unmute and start again? No, we still cannot hear you. Distinguished Minister, we will come back. We invite Togo now to take the floor, and we will work with you to resolve these issues. Your Excellency from Togo, you have the floor.
Monsieur le Directeur général, Mesdames et Messieurs les ministres, chers collègues, distingués invités, nous nous inclinons devant la mémoire de tous ceux qui ont perdu leur vie dans l'actuelle pandémie de COVID-19 et souhaitons un bon rétablissement à tous les malades. Monsieur le directeur général, le gouvernement togolais félicite et salue l'Organisation mondiale de la santé pour son rôle moteur dans l'organisation de la riposte contre la COVID-19, à travers notamment son appui technique et financier, mais surtout les lignes directrices qu'elle édicte au fur et à mesure que les connaissances sur la maladie s'améliorent. Dans le même sillage, je voudrais ici saluer les autres organisations internationales, l'Union africaine, les organisations régionales, les pays amis et les philanthropes pour leur appui multiforme au contrôle de cette pandémie. Dès le début des alertes relatives au caractère pandémique de cette maladie et à la menace qu'elle représente pour tous les pays, un comité de gestion de la crise, présidé par le chef de l'État, a été mis en place dans mon pays. Des mesures appropriées ont été prises pour protéger les populations et limiter la propagation du virus. Ces mesures recherchaient le juste équilibre entre la protection de la santé des populations, la protection de l'économie nationale, la protection des droits sociaux et le respect des droits humains sous leurs divers aspects. Je vous remercie de votre bienveillante attention.
Merci, Monsieur le Ministre. We are going back to Mali. Distinguished Minister, you have the floor.
Je ne sais pas qui avait gardé son appareil, non? Hein? C'est la technique. C'est chez eux? Ah.
It seems we still have technical problems with Mali. I will now like to invite Haiti. Honorable Minister, you have the floor.
Prendre la parole au nom de la ministre de la Santé d'Haïti, Madame Clément. Madame la Présidente, Monsieur le Directeur général de l'OMS, Excellent, Mesdames et Messieurs, permettez-moi d'abord de vous transmettre un vœu, président de la République d'Haïti, Jovenel Moïse, pour une assemblée mondiale de la santé consultative et fructueuse. Haïti souscrit à la déclaration prononcée par au nom du peuple francophone. Madame la Présidente, ma délégation félicite pour l'accès de votre pays, la communauté du monde web des Bahamas, nation chère de la Caraïbe, à la présidence de cette dite assemblée. Comme la plupart des pays, Haïti a décidé des mesures visant à prévenir et à contrôler la propagation de la pandémie de COVID-19. Avant même la manifestation de la maladie sur le territoire, les autorités haïtiennes ont élaboré, selon les directives de l'OMS, un plan de préparation et de réponse. Le 19 mars dernier, suite à la confirmation du premier cas, elles ont aussi décrété l'état d'urgence sanitaire sur toutes les zones du territoire. Dans le même ordre d'idée, une cellule scientifique, une commission sectorielle de gestion ont été mises en place. Des mesures barrières ont été renforcées et enfin, des ressources additionnelles ont été mobilisées pour la mise en œuvre du plan. Jusqu'à date, Haïti a enregistré 450 cas confirmés, 20 décès et 21 guérisons. Toutefois, force de reconnaître qu'en raison de la faiblesse de son système de santé, le pays n'est pas en mesure de faire face tout seul aux nombreux défis à la pandémie. La solidarité et la coopération internationale s'avèrent plus que jamais indispensables. Madame la Présidente, cette pandémie de COVID-19 est venue souligner pour nous la nécessité d'avoir des systèmes de santé solides et résilients, basés sur la solidarité internationale comme fondement de la sécurité sanitaire mondiale et de la couverture sanitaire universelle. À cet égard, Haïti soutient pleinement la plateforme internationale visant à accélérer le développement et la distribution équitable des tests, des traitements et des vaccins, ainsi que le renforcement des systèmes de santé des pays les plus vulnérables. Par ailleurs, ma délégation encore, une fois plaidé en faveur des Taïwan et les discussions à l'OMS, ne serait d'observateurs. Aujourd'hui, rien ne justifie que ce peuple qui a montré l'efficacité de son savoir-faire et la force de son système sanitaire dans la gestion de la COVID-19 sur son territoire soit resté en dehors du système de santé mondial. Pour finir, Haïti présente ses condoléances à toutes les victimes de la COVID-19 et profite pour exprimer sa solidarité aux travailleurs de la santé, au gouvernement et au peuple qui en sont touchés. Haïti est convaincu que par la commun de nos risques et de nos connaissances, nous arriverons à surmonter cette crise sanitaire mondiale sans précédent. Merci de votre attention.
Merci, Monsieur le Ministre. I would like to invite Maldives. Your Excellency, you have the floor.
Director General, my fellow Ministers of Health and other representatives from member countries, Chairperson, Assalamu alaikum and warm greetings from Maldives. At the very outset, I wish to state that in this time of an unprecedented global public health crisis caused by the COVID-19 pandemic, peoples and nations, and above all, we Ministers of Health need to stay ever more focused, resolute, and lead the efforts to overcome this calamity. For countries as well as for WHO, this crisis has taught many lessons. That no country or the world could predict a crisis of this nature or magnitude, that the less obvious consequences or collateral can be as impactful. As countries exhaust all their resources and energy on COVID-19, there may be other neglected health issues and health system needs, as well as socio-economic fallout from this crisis. Therefore, in my opinion, we need to look beyond and the aftermath of the pandemic. Another important conclusion we can draw from this crisis is the importance of health in all spheres of life, be it economy, be it environment, or any other aspect of life. The primacy of health cannot be undermined. When the world is faced with global health crisis, it is all of humanity that suffers. Mr. Chair, just like other countries, and despite early and rigorous efforts, Maldives was unable to prevent it from our shores and had to face its consequences. On one hand, the freeze on tourism activities and fishery exports were affecting our very livelihoods, while on the other, manufacturing countries were placing embargoes and global movements of goods came to a grinding halt. This affected us badly, impacting our containment efforts as well. Medical and other supplies were becoming very hard to procure and import. Here I wish to laud and appreciate the regional leadership by WHO Regional Office and bilateral assistance from neighboring countries, particularly that of India. And although not from our region, we also wish to note the assistance from China. Maldives, China has enjoyed decades of cooperation based on our commitment to One China policy. Indeed, we can contain this pandemic only through regional and international cooperation, and when all countries start working together and sharing critical information and resources. Viruses do not recognize borders. Together as one world, we can overcome COVID-19. Thank you.
Thank you, Honorable Minister. I would like to invite Brunei Darussalam. Your Excellency, you have the floor.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Mr. President, Vice President, Honorable Ministers, Director General, ladies and gentlemen. On behalf of the government of Brunei Darussalam, I wish to extend our sympathies to all who have lost loved ones and express our solidarity with those affected by COVID-19 and the healthcare workers and frontliners who work tirelessly to combat this. Since the start of the outbreak, we have detected a total of 141 cases and reported 1 death. Thankfully, through a careful program of testing, contact tracing, isolation and treatment, we have managed to control our first few clusters. Although the battle is not yet over, I wish to share 2 lessons from our experience in responding to COVID-19. First is the importance of enhanced surveillance and testing. We are an early adopter of testing in absence of symptoms, and we also conduct random sampling in community health centers and among the foreign worker population. Our test per capita ratio is among the world's highest, and we believe that containment efforts have been crucial in preventing widespread community transmission. Second, we established an effective community engagement strategy with daily press conferences, a dedicated 24-hour hotline for public inquiries, and a self-screening mobile application integrated with artificial intelligence and data analytic capabilities. Civic society has played a key role, and a significant grassroots movement sparked a surge of volunteerism and community advocacy. Our emphasis on containment along with community engagement has allowed us to control the disease without resorting to whole-scale lockdowns. Although we have implemented some level of moderate physical distancing, public services and businesses remain open and no movement restriction within the country have been imposed. As such, this combination of targeted approaches can be a useful way forward in the months ahead. Adopting a phased approach to de-escalation and leveraging technology for swift contact tracing could be a viable strategy to sustain the response to COVID-19 pandemic. We stand ready to work with WHO and the global health community on this important issue. Thank you.
Thank you, Honorable Minister. We would now like to invite Paraguay. Your Excellency, you have the floor.
Señor Presidente de la Asamblea Mundial de la Salud, Estados miembros, señor Director de la Organización Mundial de la Salud. La reunión de este año se realiza de modo no habitual, en un contexto extraordinario que interpela a toda la civilización para hacer frente a una pandemia que obliga a replantear nuestros sistemas de salud y la integración de nuestros pueblos. El Paraguay ha tomado decisiones drásticas de distanciamiento social muy tempranas, en consideración a la reciente mayor epidemia de dengue de su historia y de la fragilidad de su sistema de salud pública que actualmente se encuentra en un proceso de reforma, pero sobre todo en reconocimiento del valor de la vida. A 65 días de aquel momento, los datos actuales demuestran que las decisiones tomadas han sido correctas. Ahora toca la tarea, si se quiere más complicada, de levantar restricciones gradualmente y llevar adelante lo que hemos denominado como cuarentena inteligente, para enfatizar el concepto de dinamismo de las medidas y evitar el relajamiento en la estrategia. El pueblo paraguayo ha alcanzado una cohesión en torno a estas medidas, que acompaña con entusiasmo, incorporando un nuevo estilo de vida. Por otra parte, ante la rápida propagación del virus, resulta imperativo incluir a todas las partes relevantes, ya que la prevención y la contención epidémicas trascienden las fronteras. La plena participación de Taiwán en la Organización Mundial de la Salud y el estatus de observador en la Asamblea le permitirán a Taiwán compartir su experiencia con todo el mundo. Transitemos juntos por esta senda de desafíos impensados, poniendo lo mejor de nosotros, velando por nuestros pueblos, sabiendo que la humanidad puede y debe buscar maneras cada vez más justas y efectivas de convivir y crecer. Muchas gracias.
Thank you, Minister. We would now like to invite Pakistan. Your Excellency, you have the floor. We will continue with Ethiopia. Honorable Minister, you have the floor.
Thank you, Chair. Ethiopia commends the Director General for his inclusive report on COVID-19 and highly appreciates the fundamental leadership role of WHO in coordinating the comprehensive global response to the COVID-19 pandemic, as well as supporting the national response efforts of member states. The dedication of WHO leadership and staff demonstrated is to be highly valued rather than undermined during this crucial moment. Excellencies, distinguished delegates, the increased adverse impacts of COVID-19 pandemics on the lives of people and in the fabrics of society around the world is concerning. The virus is not only attacking the health of our people, but also devastating economies, social and cultural lives, and affecting our way of living at large. This is why the COVID-19 response requires a whole of government, a whole of society approach at national level and increased collaboration and support with a spirit of solidarity at the global level. Ethiopia calls for universal, timely, and equitable access to quality, essential, affordable, and efficacious health technologies and products, including vaccines, diagnostics, therapeutics, and protective equipment. We call for the removal of all kinds of legal, policy, or technical barriers that impede access. Since the first case was identified in Ethiopia on March 13, 2020, the government of Ethiopia took decisive measures, multidimensional measures to contain the spread of the disease in the country. Ethiopia is also actively contributing to the continental response through ensuring timely distribution of test kits and protective equipment to the African countries in collaboration with WHO, Africa CDC, and our partners. Ethiopia is committed to continue working closely with our neighboring countries to control the spread of this devastating disease in the region. I would like to conclude by reiterating that the only way out of this unfortunate and dreadful situation is collaboration based on respect and solidarity. I would also like to emphasize the instrumentality of WHO's leadership in order to overcome the challenge and to recover quickly by adopting to the new norm of global health security and health diplomacy. Thank you.
Merci, Madame la Ministre. Nous invitons Gabon. Votre Excellence, vous avez la parole.
Madame la Présidente, la délégation gabonaise vous félicite pour votre élection à la présidence de la 73e Assemblée mondiale de la santé et se réjouit de la tenue de cette Assemblée mondiale virtuelle en cette période de pandémie dévastatrice. Madame la Présidente, le Gabon a notifié son premier cas de COVID-19 le 12 mars 2020. Cependant, dès le 25 février, le président de la République, chef de l'État, son Excellence Ali Bongo Ondimba, avait instruit le Premier ministre, chef du gouvernement, de coordonner l'ensemble des interventions liées à la préparation et à la riposte à la COVID-19. C'est ainsi qu'un comité de pilotage du plan de veille et de riposte contre l'épidémie à coronavirus au Gabon et une commission technique nationale en charge de la coordination des interventions techniques sur toute l'étendue du territoire ont été créés, de même qu'un comité scientifique, tout en veillant à assurer les fonctions essentielles du système de santé pendant la phase 4 de l'épidémie à coronavirus. Le Gabon a pris un ensemble de mesures, tant sanitaires, sécuritaires, sociales qu'économiques, pour maîtriser les chaînes de transmission locales. Pour ne parler que des mesures sanitaires, l'accent a été mis sur le dépistage de masse, la prise en charge médicale et psychologique des cas de COVID-19, la recherche active des cas contacts et leur confinement, la communication sur les risques et par-dessus tout, la protection des personnels de santé et la promotion des mesures barrières. Madame la Présidente, la pandémie de la COVID-19 est bien plus qu'une crise sanitaire, économique et sociale. C'est un bouleversement de l'équilibre planétaire préétabli qui doit nous amener à repenser nos échanges de valeurs, réinventer nos modèles économiques et utiliser tous les paradigmes qui guident la coopération internationale. Les remèdes contre le coronavirus, il n'y en a point pour l'heure, mais déjà pointe à l'horizon de grandes manœuvres pour le contrôle d'une ressource qui, si elle n'est pas partagée, ne profitera à personne. Cette situation préoccupante nous donne l'occasion de faire un plaidoyer pour que les thérapies curatives et préventives liées à la COVID-19 soient les biens universels partagés équitablement par les peuples. Il en est de même sur l'urgence et l'impérieuse nécessité de trouver des remèdes à toutes les maladies qui tuent et déciment bien plus que la COVID-19 dans les pays en développement et singulièrement en Afrique, car il en va de la sécurité sanitaire de l'humanité tout entière. Enfin, le Gabon salue l'action de l'OMS, l'Afrique CDC et de tous les partenaires engagés à ses côtés dans la riposte à la COVID-19 et réitère son total soutien au directeur général de l'OMS, le Dr Tedros. Je vous remercie.
Merci, Monsieur le Ministre. I would like to invite Belarus. Your Excellency, you have the floor.
Господин председатель, пандемия коронавируса представляет серьезный вызов современному миру. Ее последствия политические, экономические, социальные коснутся нас всех. В этом нет никаких сомнений. Пандемия еще не завершилась, но мы уже можем обсуждать некоторые вынесенные уроки. Беларусь хотел бы акцентировать внимание на трех. Первое. Пандемия продемонстрировала, что в мире нет единства и солидарности, которые позволили бы нам, сообща, выработать быстрый и эффективный ответ. Это закономерный результат нынешней геополитической неопределенности. Президент Беларуси Александр Лукашенко предложил выход из ситуации, провести глобальный диалог по безопасности. Такой диалог должен привести к более конструктивным международным отношениям. Это, в свою очередь, позволит нам сообща эффективно заниматься всеми трансатлантическими угрозами. Второе. Пандемия показала необходимость наличия эффективного глобального координационного органа. Таким, безусловно, является Всемирная организация здравоохранения. Убеждены в необходимости дальнейшего укрепления организации и ее механизмов реагирования на вызовы в области здравоохранения. Третье. Национальный контекст является важным фактором при выработке ответа на пандемию. Убеждены в том, что Беларусь выбрала правильную линию. Мы в оптимальной мере сохранили жизнедеятельность государства и его экономики, но при этом обеспечили максимальную защиту населения. И мы справляемся с оказанием медицинской помощи в таких жестких условиях. Благодаря сохранению действия структуры санитарно-эпидемиологической службы, которая в условиях пандемии явилась ключевым инструментом предотвращения неуправляемого развития инфекции, проводя масштабные и тщательные эпидемиологические расследования. Кроме того, нами были заблаговременно разработаны планы реагирования на различные сценарии развития ситуации. Каждый сценарий был обеспечен кадрами, финансовым, медицинским оборудованием, лекарственными средствами и коечным фондом. В нашей стране была сохранена высокая обеспеченность населения койками, в том числе инфекционными и реанимационными, что позволило сохранить доступность медицинской помощи всем нуждающимся, даже в условиях пандемии. В республике не вводился тотальный карантин. Вместе с тем, все научно обоснованные противоэпидемические мероприятия и меры, рекомендуемые Всемирной организацией здравоохранения, выполняются. Нам удалось добиться минимальных значений показателей смертности, ниже 1%. Как сейчас мы наблюдаем, многие страны, выходящие из карантина, по сути, начинают проводить такую же линию, которую Республика Беларусь выбрала с самого начала. Господин председатель, позвольте выразить надежду, что нынешняя нетрадиционная сессия ВОЗ ознаменует собой переломный момент в борьбе с пандемией. Спасибо за внимание.
Спасибо большое. I would like to invite Angola. Your Excellency, you have the floor.
Excellency, Madam President of the World Health Assembly, Excellency, the Director General, distinguished delegates, This year, we are in a different way, in a very complex sanitary and economic context that requires our country individually and collectively to find innovative and pragmatic strategies to respond to the challenge never experienced in the recent history of humanity. Excellency, Angola, like the other countries, is in a demographic, epidemiological, and economic transition, with the health having several challenges in parallel high level of with the Republic of China. The country started in February this year implementation of technical prevention and preparedness against COVID-19. As soon as it became aware the occurrence of major events in that country, the executive, under the high direction of our President, João Lourenço, adopted the National Multi-Sectorial Plan with specific financial resources allocated by the Ministry of Finance of Angola. Initially, the measure consisted of closing borders, banning commercial and private passenger flights from Angola abroad and vice versa, institution of mandatory quarantine with surveillance of passengers and flights, transport of support for healthcare and placing immunological surveillance to suspected cases and their contacts. Also, the consequent measures consist of: number one, declaration of emergency and the publication of decrees. Number two, establishment of interministerial commission coordinated by the presidential office as well as the decrees. We approved with specific measures aimed to delaying the introduction and transmission of virus, the spread of pandemic throughout the country, protecting the most vulnerable population and the function of the economy of Mrs. President, the early implementation of these measures, in addition to home confinement, social distance, hands hygiene, wearing masks, and extensive information campaigns on the epidemic of others has allowed the situation to be controlled. Today, we are with 50 cases. So far, confirmed 3 deaths, 30 active and 14 recovered patients. The National Institute of Health Research has already proceeded 5,978 tests, but we are very about the community transmission phase because massive testing a challenge. The big challenge is in Angola, the wide screen of population group of at risk for the characterization of community circulation of virus. We therefore take the opportunity to ask for support of WHO in this area, as well as the strengthening of mechanisms to improve cross-border health surveillance within the framework of international health regulation. I seized the opportunity to express Angola's to the draft resolution of COVID-19 response submitted to the WHA-73 as well as to associate ours with statements delivered by the African group and the non-aligned movement, and concur as well with deliberations proposed by the WHO.
Excuse me, Madam Delegate, I must interrupt. I was trying to be very understanding and lenient with you, but you have unfortunately far exceeded the time limit. I must implore speakers to adhere to the time limit. 2 minutes for national statements and 4 minutes for group statements. I do apologize.
Thank you. Thank you very much for that.
Thank you, Madam Minister, and thank you, Madam President. We would like to invite Albania. Your Excellency, you have the floor. We would like to invite Slovenia. Your Excellency, you have the floor.
Distinguished President, Director General, dear delegates, Slovenia would like to align itself with the statement of the EU and its member states. Response to the COVID-19 pandemic has demonstrated that Slovenia has a strong public health system with well-coordinated primary health care and public health program for emergency preparedness and response. Efficiently organized civil protection with strong and dedicated health workforce, including laboratories, helped mitigate the health impacts of the pandemic. WHO external evaluation of the international health regulations core capacities performed in Slovenia in 2017 contributed to improve national emergency preparedness and multi-sectoral approach. Consequently, we perceive such evaluations as an important contribution to the implementation of the international health regulations. We have all experienced many uncertainties in responding to COVID-19. Slovenia appreciates the efforts of WHO in coordinating global response and is stressing the need for an appropriate evaluation that will contribute to better preparedness in the future. It has become evident that ensuring adequate and equitable access of essential medicines, medical equipment, personal protection equipment, and supplies is crucial. Transparent and inclusive international policies toward the development, manufacturing, and distribution of vaccines and medicines are needed for efficiently responding to the pandemic such as COVID-19. Providing access to new affordable vaccines, medicinal products, diagnostics and treatments in the spirit of global solidarity for all is necessary for our common success. To conclude, COVID-19 pandemic is a huge test for our health systems and societies. We strongly believe that cooperation and concrete action is accelerating implementation of already agreed international commitments is vital for ensuring preparedness and appropriate response in safeguarding health of our populations now and in the future. Thank you.
Honorable delegates, we have been at it for quite a while now. I think it would be good for us to take a short break. I suggest 10 minutes. I will ask the Secretariat to give an indication of who will be the speakers upon our return.
Thank you, Madam President. We will start with Turkmenistan. Slovakia, Austria, Mali, Timor-Leste, Egypt, Sierra Leone, and then we will continue. Thank you.
10 minutes, please.
taking swift, decisive, and evidence-informed action against the COVID-19 pandemic. The region continues to be guided by the Delhi Declaration, which health ministers of the region adopted in 2019, stressing a risk-based approach to emergency preparedness and response, which since 2014 has been one of the region's 8 flagship priorities. It was on the 13th of January that the first reported case was detected outside of China in Thailand. Since then, member state action, led at the highest levels with a whole of government and whole of society approach, has restricted the regional's case count to a comparatively low level. Thailand has now flattened the curve and is preparing to further lift restrictions. India launched very early containment measures, including a complete nationwide lockdown with a massive scale-up of lab capacities. Bangladesh, Indonesia, and Nepal are using WHO's Go Data tool to carry out robust contact tracing. Bhutan, Maldives, and Timor-Leste are demonstrating how small countries with geographical vulnerabilities can generate and apply maximum capacity. India, Indonesia, Thailand, and Sri Lanka have taken the initiative to participate in WHO's path-breaking solidarity trial, and Myanmar and DPR Korea were among the first countries to develop and finalize their preparedness and response plans. WHO has provided member states in the region its full technical, operational, and material support, from sharing key guidance and training health personnel to providing PPE and laboratory equipment and helping to plan, identify, and meet resource requirements. The region's pursuit of universal health coverage, with a focus on human resources for health and essential medicines, has strengthened health systems region-wide, which is helping member states to protect the continuity of essential health services as they directly respond to the pandemic. We have a rich tradition of solidarity and mutual support, which is reflected in the Southeast Asia Regional Health Emergencies Fund, which has been fully harnessed from the start of the outbreak. The region's world-class medicine and vaccine manufacturing capacity will be critical to global efforts to develop and produce safe and effective therapeutics and vaccines, and to ensure they are equitably distributed to all of humanity. WHO is committed to moving forward to control and suppress spread and empower individuals and communities to stay safe, healthy, and well.
Madam President, Your Excellency Kiva Bain, Honorable Ministers and Secretaries of Health, Director General of WHO, Dr. Tedros, distinguished delegates, WHO staff and colleagues, esteemed ladies and gentlemen, a very good day to you all. We are living in unprecedented times. We have been engaged over this past 5 months in an unrelenting battle against the COVID-19 pandemic, as well as the monumental economic and social emergencies that have been generated by the rampage of this virus. Countless lives have been lost, including those of many healthcare workers, and millions are facing impoverishment as they are without work, social protection, and basic income. In the Americas region, PAHO has continued to coordinate the pandemic response across countries, and we call on all national and local health authorities to work even more closely together, not only to contain the spread of the virus, but also to support the further strengthening of the health system capacity while building resilience for the future. COVID-19 has exposed the critical weaknesses in our health systems, the inadequacies of our social protection systems, and the inefficacy of approaches to public health. The sustained and persistently low levels of investment in health systems over time has impacted our capacity to respond to COVID-19, while at the same time ensuring continuity in the provision of essential health services. A piecemeal approach to social protection, including in health, has meant that the poor and most vulnerable have been most negatively impacted by COVID-19. Further, our public health emergency preparedness and readiness capacity has been found wanting, as we have not built the necessary capacities in the essential public health functions at the national level. As we address the immediate public health emergency, we recognize that our health systems of the future must be responsive, adaptive, and inclusive. A renewed political commitment, together with a corresponding investment, is required to build resilient health systems, ensuring universal access to health and universal health coverage. Additionally, a new and more profound degree of policy integration will be required in health and social development so as to ensure universal social protection and universal health. Our countries must effectively respond to the COVID-19 pandemic in order to ensure that the fundamentals for an economic recovery are in place. This is because the health of the people is
part of the health system and every health worker. COVID-19 is an encounter with the future. We know others will come. This would include the health impact of climate change, surging rate of non-communicable diseases, and rapidly aging populations. Our regional vision for the future is more relevant than ever. So many people around the world have suffered from COVID-19. I think it is not just our responsibility to respond to this outbreak, but it is our obligation to make our societies and health system stronger and better prepared to face the challenges of tomorrow.
Honorable delegates, I'm true to my word, at least I've tried to be. I would like to welcome you all back from your break. We will now continue to hear the statements by delegations which are provided under item 3. Before I turn the floor over to the Secretariat to manage this session, I thought I should explain why I'm insisting that we try and limit our statements to the time limits previously agreed. So far, we have heard quite a number of delegations submit their interventions on a subject that is of paramount concern to the international community. But just for the information of delegations, I would like to advise you that we still have 75 speakers on the list. Having said that, I would implore delegations to adhere to the time limit of 2 minutes for national statements. I do appreciate and understand that this is an historic session, and you want to be able to let the international community know your national concerns. But we have an aggressive agenda, and if we are to finish in the time limit, I really need the understanding and cooperation of the remaining speakers. I will now turn the session over to the Secretariat.
Thank you, Madam President. I will now read out the names of the 5 member states to speak next. Turkmenistan, followed by Slovakia, Austria, Mali, and Timor-Leste. We would like to invite Turkmenistan, followed by Slovakia. Excellency, you have the floor.
Уважаемый господин, благодарю за представленное слово. В соответствии в связи с возникновением ситуации мира COVID-19 во главе уважаемый реагировала на ситуацию COVID-19. Вы начали предпринимать профилактические меры по защите территории нашей страны от завоза и распространения данной инфекции. Государственную границу усилили контроль, карантинный надзор. На уровне Кабинета министров Туркменистана было создано и проведено заседание чрезвычайной комиссии, и состав которой входит все и ведомства стран. Соответствуем мерам реагирования и возникновения ситуации в стране. Разработан межведомственный план по предотвращению завоза и распространения коронавируса COVID-19, усиление противоэпидемических мероприятий, а также усилена работа среди всех слоев населения по пропаганде выполнения гигиены и ведения здорового образа жизни. Созданы также противовирусные средства и тест-системы для диагностики COVID-19, дезинфектантов, средств индивидуальной защиты и другие. Совместно с ВОЗом разработан проект плана готовности реагирования к местам на случай коронавирусной инфекции COVID-19. Что касается стратегии безопасного ослабления ограничений и поэтапного изменения ограничительных мер, Туркменистан планирует действовать в ситуации и опыт других стран. И пока все выведенные ограничительные меры продолжают действовать. Кроме этого, я хотел бы отметить инициативу с президентом Туркменистана, выдвинутую на недавно проходившем онлайн-саммите глав государств и правительств движения и присоединения, по которым уважаемый президент обратил огромное внимание широкую механизму научной дипломатии по борьбе с пандемией и его последствиями, а именно тесному взаимодействию между профессиональным обменом опытом, знаний и информацией по методам лечения и профилактики заболеваний, медицинским препаратам и оборудованием, средствам индивидуальной защиты. В этом концепте план является предложением
Excellency, my apologies. Excellency, the audio quality is a bit too bad for us to be able to interpret what is being said, so we'll need to come back to you in a moment when we have better audio connection. So we'll have to move to the next country, and we'll come back to Turkmenistan in a minute. Thank you, Excellency. We'll move to the next country because the audio was not good enough for us to be able to interpret what was being said. We'll come back to you in a minute. I now would like to invite Slovakia to be followed again by Turkmenistan. So Slovakia, Excellency, you have the floor.
Honorable Chair, distinguished Director General, colleagues. Slovakia aligns itself with the EU statement and EU co-sponsorship of draft resolution on COVID-19 response. Let me start by saying that the global reach of the novel coronavirus has been showing us that although we may have faced numerous challenges in the past, this one is indeed different. It is also important to stress that meanwhile our focus is set on the general population, the vulnerable and marginalized groups should not be placed under the radar and deserves our undivided attention. Furthermore, the appropriate attention should be also drawn to the fact that once the vaccine against COVID-19 is released for the treatment use, the international community should make sure it will not be commercialized in the first place, but rather it should represent an instrument for the general good. At international level, Slovakia considers the best practice and information sharing as a key tool for managing the pandemic efficiently. We have observed that deaths reporting due to COVID-19 varies significantly, creating hidden asymmetrical picture about the country's data statistics. Therefore, we would invite the WHO to provide guidance on data collection and their reporting in order to ensure reliable international comparison. Slovakia widely supports the global efforts to tackle the novel coronavirus, and I wish to reiterate the firm commitment of my country to work with the WHO, the states all over the world, and other relevant partners in the spirit of global solidarity. Thank you very much.
Thank you, Minister. We would like to invite again Turkmenistan. That will be followed by Albania. Excellency, you have the floor again.
Господин председатель, благодарю за предоставленное слово. Хотел отметить в связи с возникновением ситуации в мире по COVID-19 правительства Туркменистана. Уважаемый президент Гурбангулбек Мухаммедов реагировал на ситуацию по COVID-19. Мы начали предпринимать профилактические меры по защите территории нашей страны от возможности распространения данной инфекции. На государственных границах усилен санитарный карантин и надзор. На уровне Кабинета министров Туркменистана были созданы и проведено заседание чрезвычайной противоэпидемической комиссии, в состав которой входит все министерства и ведомства страны. Задействованы как меры реагирования и возникновения чрезвычайной ситуации в стране. Разработан межведомственный план по предотвращению завода и распространению нового коронавируса COVID-19, усиление противоэпидемических мероприятий, а также усиление работы среди всех слоев населения по пропаганде выполнения правил личной гигиены и ведения здорового образа жизни. Создан запас противовирусных лекарственных средств и есть системы для диагностики COVID-19, консультантов, средств индивидуальной защиты и другие. Совместно с ВОЗом разработан проект плана обеспечения готовности реагирования Туркменистана на случай коронавируса инфекции COVID-19. Что касается стратегии безопасного отступления ограничений и поэтапного изменения ограничительных мер, Туркменистан планирует действовать, учитывая эпидемиологическую ситуацию и опыт других стран. И пока все введенные ограничительные меры продолжают действовать. Кроме этого, я хотел бы отметить инициативу президента Туркменистана, выдвинутый на недавно проходившем онлайн-саммите глав государства и правительства движения неприсоединения, по которому уважаемый президент Туркменистана обратил огромное внимание на широкое применение механизма научной дипломатии в борьбе с пандемией и ее последствия, а именно тесное взаимодействие между профессиональными, обмен опытом, знаниями и информацией по методам лечения профилактики заболеваний, медицинских препаратами и оборудованием, средствами индивидуальной защиты. В этом контексте весьма актуальным является предложение туркменского лидера о создании международного совета ученых медиков. Это, прежде всего, налаживание необходимости в данный момент humanной связи между передовыми учреждениями здравоохранения и медицинскими центрами. Исключение искусственной изоляции физического, которые могут быть использованы для элиминации пандемии. Мы выражаем глубокую признательность сотрудничества ВОЗа по вопросу внедрения требований международных и укрепления потенциала в области готовности и реагирования системы общественного здравоохранения Туркменистана. По всему спектру возникает сейчас вопрос требует усиления координационной роли ВОЗа и ООН. Еще раз хотел бы подчеркнуть полную нашей страны, деятельность ВОЗа и поблагодарить руководство ВОЗа и сотрудников этой организации и их профессиональной работы. Благодарю за внимание.
Thank you, Minister. I now invite Austria to be followed by Mali. Excellency, you have the floor.
Ministers, Excellencies, Austria fully aligns with the statement of the European Union and its member states. Our crisis management fights primarily a virus, SARS-CoV-2. Many of us are quite successful in implementing our containment programs. But we have to focus also simultaneously on the support of our economies, labor markets, reopening schools and universities, international travel and tourism. Austria is now in the phase of adaptive recovery, going forward in 2-week steps. We started in mid-April by opening all stores and services, and by the end of May we will back to be normal life. In Austria alone, the economic impact of this pandemic crisis is enormous. We might end up with a minus of 7.5% in GDP in 2020. From WHO, as a supreme technical health authority, we expect objective technical guidance in many of these areas. This pandemic is not alone about health. We, who are very early in this, have to develop all right measures for this adaptive recovery instantaneous without being able to look at many good practices. Another global concern we want to share. We all should consider future COVID-19 medical treatments and vaccinations as a global public good, accessible to all member states at a reasonable price. WHO in this regard has also to play an important role to facilitate solutions regarding intellectual property rights. Austria has shown international solidarity by pledging 31 million euros at the Coronavirus Global Response International Pledging Event, recently hosted by the European Commission. On behalf of Austria, I would like to thank WHO and the Director General for their leadership and their excellent work. Dr. Tedros, we trust in you and WHO.
Thank you, Minister. I now give the floor to Mali, followed by Egypt. Excellency, you have the floor. Mali, please turn on your sound so that we can hear you. Okay, we'll come back to you a bit later, Mali. I will now give the floor to Timor-Leste. Timor-Leste, you have the floor. We'll also come back to Timor-Leste. I will now give the floor to Egypt. Egypt, you have the floor. Okay, we'll come back to Mali, Timor-Leste, and Egypt a bit later. I will now give the floor to Sierra Leone. Sierra Leone, you have the floor. So as we're trying to resolve some communication problems, or some connection problems rather, we will now go to Spain. Spain, you have the floor.
España agradece al director general su intervención e informe sobre diferentes trabajos de la organización, en especial la actualización de la situación de la pandemia global por SARS-CoV-2, así como por los esfuerzos de la OMS para dar apoyo a los países. Sobre este particular, España enfatiza en la colaboración cercana que está teniendo la OMS en apoyo de los trabajos de nuestro país en la lucha contra la pandemia. Me gustaría, por tanto, poner de manifiesto la importancia de la organización y la confianza en su labor como elementos vitales para su puesta en valor, lo que hace necesario que se refuerce el sistema de salud global evitando duplicidades. Confiamos en que la OMS siga desempeñando un liderazgo bien reconocido a nivel mundial y lo haga a través de la escucha activa de las peticiones de los Estados miembros, siguiendo la máxima de responder de manera efectiva y eficiente. España apoya a la OMS en su papel vertebrador de diferentes esferas en el abordaje multisectorial de la salud. Es el momento de demostrar que el futuro, sin duda, precisa ser diseñado como un reto compartido entre todos, siempre teniendo en cuenta la dimensión de género y cómo sensibilizar a la ciudadanía. Pongamos en marcha mecanismos robustos de cooperación e información. Establezcamos lazos permanentes entre la ciencia y los que toman decisiones políticas, sin olvidar a otros agentes y a la sociedad. Para España, la cobertura sanitaria universal, hoy más que nunca, es la piedra angular para disponer de sistemas sanitarios eficientes, resilientes y de calidad, que den respuestas a emergencias, pero también en la protección permanente de la salud. Reforcemos los sistemas públicos basados en la continuidad asistencial, centrados en la atención primaria y en los pacientes. Busquemos con ahínco las metas establecidas en la ODS 3 de la Agenda 2030. Reforcemos la cooperación internacional en el mejor acceso a las vacunas, los medicamentos, los test diagnósticos y la ciencia para el COVID-19. Animamos la iniciativa ACT Accelerator que coordina la OMS. España confía e insta a otros Estados miembros a que sirvan al fortalecimiento del consenso y el multilateralismo representado por Naciones Unidas, con la OMS jugando un papel central. Confiamos por ello en culminar esta 73 Asamblea Mundial de la Salud adoptando por consenso la resolución sobre la respuesta a SARS-CoV-2. Necesitamos un nuevo acuerdo global en salud para reforzar las capacidades nacionales frente a las nuevas pandemias. Impulsemos el acceso al agua y al saneamiento, la salud en el trabajo, la lucha contra el cambio climático, abogando por las energías renovables. Muchas gracias.
Thank you, Minister. I now give the floor to Cook Islands, to be followed by Marshall Islands. Cook Islands, you have the floor.
Excellencies, ladies and gentlemen, kia orana. Today we come together as one, as health leaders representing health systems around the world. Let us use this opportunity, even for just a brief moment in time, to coordinate our efforts against COVID-19 in unity. On behalf of the Cook Islands government, I extend our prayers and sincerest condolences to those who have lost lives and livelihoods from this devastating pandemic, COVID-19. The Cook Islands is one of a few countries that remains COVID-19 free. This was a result of our early national health emergency response and the mobilization of our communities to implement critical public health measures. Our health system has been reoriented to optimize universal health coverage and to focus on primary care and preventative community-based health services. This is designed to enable rapid detection of COVID-19 and activation of contact tracing, as well as address the burden of NCDs. The social and economic impact has been severe for many countries, the Cook Islands included. We are progressing economic recovery measures that promote climate change mitigating initiatives and the protection of our social and physical environment. Strategies to safely ease border restrictions are requiring transnational conversations to ensure we protect both our population and those beyond our borders. We are adapting to our new norm and the new opportunities that have risen to provide quality, equitable health services. Finally, I wish to thank WHO, SPC, the New Zealand and Australian governments, and other development partners for assisting the Cook Islands in our national response. We are in this together, so no one gets left behind. Kia orana e kia manuia.
Thank you, Minister. I now give the floor to the Marshall Islands, to be followed by Uruguay. Marshall Islands, you have the floor.
Excellencies, Mr. President, Dr. Director General, Yahweh and greetings from the Republic of the Marshall Islands. The Marshall Islands fully supports the Pacific Islands statement delivered by the government of Nauru. Mr. President, my country remains one of the very few nations that remain COVID-free due to our collective efforts and early interventions. We are still undertaking measures to strengthen our health infrastructure. We sincerely thank our partners for their support, but much more is needed. We encourage the WHO and the international system to continue to strengthen its specific approaches on public health responses. Mr. President, the Marshall Islands joins other nations calling for an objective and independent investigation into actions around the early COVID-19 international response. It is very important that timely and transparent information be shared. Mr. President, the Marshall Islands also joins other nations calling for Taiwan's participation at the WHA and the WHO activities, ending unfair treatment which has endangered global health. Without active WHO participation, the Republic of China, Taiwan, risks becoming a cap in our global health system, despite strong efforts and generous contributions for other countries, including mine, to preventing and containing COVID-19. Mr. President, Taiwan, Republic of China, Taiwan has proven again to be a valued partner to countries in need, including my own. With experiences from coronavirus, all countries, including Republic of China, Taiwan, should collaborate and cooperate for a healthier future. Thank you, and Kamoltata.
Thank you, Minister. I now give the floor to Uruguay, to be followed by Ecuador. Uruguay, you have the floor.
Desde Montevideo, Uruguay, en este Ministerio de Salud Pública, tenemos el agrado de ofrecerles lo que ha sido nuestra acción frente a la epidemia de COVID-19. En primer lugar, hemos realizado una campaña de bien público de coronavirus a los efectos de dar a difundir todos aquellos aspectos de consulta precoz. Hemos diseñado una aplicación móvil que va guiando al usuario a diferentes niveles de complejidad y lo pone en contacto con su usuario. Hemos privilegiado la atención primaria en domicilio sin necesidad de concurrencia a los centros hospitalarios. Se han reprogramado las intervenciones quirúrgicas de coordinación, así como las consultas médicas que fueran innecesarias a los efectos de liberar camas de CTI. Se realizó desde el primer día de diagnóstico una declaración de emergencia sanitaria nacional, se aseguró el acceso a la población, se redactaron las normas de protección al personal de la salud, se procedió al aislamiento social y físico, se declaró el cierre de fronteras a tiempo, se anticipó y se duplicó la cantidad de vacunas antigripales, se promovió el uso de tapabocas, se hizo una campaña además para prevenir efectos psicosociales adversos, se trazó un mapa sanitario nacional en red y se contrató un equipo de expertos médicos desarrollando además técnicas diagnósticas nacionales específicas de PCR en real time nacionales a efectos de evitar los efectos de cuello de botella. Se han capacitado a todos los recursos médicos, humanos, médicos y de enfermería, y se ha actuado de oficio en instituciones vulnerables como personas en situación de calle, en residenciales y asentamientos. Hemos asimismo trabajado en la tercera línea de tener todo el equipamiento de CTI necesario y se han iniciado líneas de investigación en lo que es bancos de plasma y tratamiento preventivo con BCG e hidroxicloroquina en personal de la salud. Asimismo se han estimulado los convenios de complementación público-público y público-privado a los efectos de dar respuesta a la contingencia. Hemos desarrollado un centro de contingencia y convalescencia y centros específicos de atención COVID. Hemos trabajado protocolos para distintos sectores de reinserción laboral y hemos desarrollado un abordaje multidisciplinario, social, económico y epidemiológico con acceso a la salud en su nivel primario, secundario y terciario. Además, hemos organizado la repatriación de connacionales y establecido corredores sanitarios para aquellos turistas o tripulantes de naves que tuvieron surtos en el puerto de Montevideo. Humanismo y calidad de atención siguen siendo el norte en Uruguay.
Thank you, Minister. I now give the floor to Ecuador, to be followed by Vietnam. Ecuador, you have the floor.
Señora Presidenta, Director General, colegas ministros y líderes distinguidos, es un honor para mí regresar a la Asamblea Mundial de la Salud en representación del gobierno del Ecuador. Con millones de casos y miles de muertos, la pandemia por COVID-19 ha ejercido una presión sin precedentes en los servicios de salud a escala global y en especial en aquellos estados en vías de desarrollo. Al respecto, los múltiples desafíos de esta crisis nos han llevado a replantear aspectos centrales de nuestros sistemas de salud, tales como la atención y acceso al servicio de grupos prioritarios, cadenas logísticas de suministros, el acceso equitativo a medicamentos y dispositivos médicos, la investigación científica y el valor de la articulación entre los gobiernos centrales y locales. Esto basado en atención primaria de salud. En este sentido, la pandemia retrocederá, pero nosotros no podremos regresar a las condiciones precedentes. Este episodio nos ha mostrado y demuestra, como nunca, que el desarrollo de respuestas conjuntas y articuladas desde la escala local, nacional, subregional, regional y global deben ser consideradas como pilares de la estructuración de un proceso sostenible de desarrollo. Esto a fin de emprender acciones concretas que permitan enfrentar de mejor manera los desafíos propios de la salud pública. En este marco, abogamos por la promoción de la salud, la prevención de la enfermedad y la recuperación y rehabilitación en todos los niveles. Propiciamos la generación de mejores espacios de participación social e inclusión de todos los actores. Y buscamos que todos los miembros de la sociedad compartan su responsabilidad en la custodia de la buena salud como un deber que ha sido consagrado al Estado y su autoridad sanitaria. Consecuentemente, celebramos iniciativas como la resolución referente a COVID-19 presentada por parte de la Unión Europea, sobre la cual expresamos nuestra decisión de coauspiciarla para generar espacios que promuevan la adopción e implementación de respuestas a la pandemia, así como la movilización de los recursos necesarios para la misma. De igual forma, nos sumamos a la propuesta realizada por Costa Rica para la creación de un repositorio para tecnologías de la salud, datos y conocimientos que sirvan para acelerar los descubrimientos científicos, desarrollo de tecnologías y compartir los beneficios de los avances científicos y sus aplicaciones. Alentamos a que los estados, el sector académico, el sector privado, las instituciones de investigación y las agencias de cooperación, entre otros, se sumen al llamado a la acción para enfrentar de manera conjunta y solidaria a la pandemia bajo la perspectiva de que la salud constituye un bien público global. Finalmente, reconocemos el liderazgo del Sistema de Naciones Unidas en la respuesta a la pandemia y agradecemos a la Organización Mundial de la Salud por su acompañamiento constante en este desafío global, del cual la humanidad prevalecerá. Asimismo, instamos a todos a continuar trabajando de manera conjunta en pro de la salud. Para concluir, apelo al espíritu de unidad y solidaridad de los estados para que pasemos del discurso a la acción mediante la intensificación de la cooperación y la colaboración en todos los niveles para contener y mitigar la pandemia de COVID-19, al igual que promover la salud y el servicio prioritario para los más vulnerables. Gracias.
Thank you, Minister. Referring back to the words of Madam President, her guidance was 2 minutes per intervention, and we would appreciate if you could hold to that guidance, please. I now give the floor to Vietnam, to be followed by the United Arab Emirates. Vietnam, you have the floor.
Excellency President, dear Dr. Tedros, Director General of World Health Organization, Honorable Minister of Health Member State, distinguished delegates, ladies and gentlemen. Vietnam was one of the first countries affected by COVID-19 and recorded the first case on January 23rd of 2020. Up to now, 320 cases have been confirmed with no deaths, and 66 were imported cases. Among them, more than 80% cases had recovered. Ladies and gentlemen, in Vietnam, with strong political leadership, we undertook series of public health measures to fight epidemics. It's like fighting against the enemy. Immediate action has been done now in a resolute and coordinated manner and instructed promptly if required. The National Steering Committee to combat COVID-19 has been set up at the early stage of the outbreak, with strong commitment from the whole system and multi-sectoral coordination for strategy include strictly prevention from outside, early detection inside, isolation treatment has been implemented effectively with engagement of the local authority to direct and mobilize all resources on site, including commands, force, means, and logistics. Today, Vietnam has managed to keep the situation under good control in the past 32 days. Vietnam has not recorded a new case in community. Vietnam, with our capacity, have actively shared information and experience of prevention control COVID-19 and provided transparency information to WHO and other countries through the IHR channel. Ladies and gentlemen, realizing that COVID-19 will stay with us for a long time, Vietnam called for further dialogue and cooperation mechanism to respond to COVID-19, to review the core capacity of member states and required by the IHR, including policy, surveillance, risk assessment, laboratory, infection prevention and control, clinical management, risk communication and resources, so as to recommend those that should be continually strengthened in the coming time. Ladies and gentlemen, I would like to take this opportunity to convey thanks to the WHO and the international community for providing support and assistance to Vietnam as well as many other member states in their effort to fight against the pandemic. I wish you all good health. Thank you very much for your kind attention.
Thank you, Minister. I now give the floor to the United Arab Emirates, to be followed by Nepal. United Arab Emirates, you have the floor. We have trouble connecting to the United Arab Emirates. We'll come back to them later. I now give the floor to Nepal, to be followed by Guyana. Nepal, you have the floor.
Namaskar. Mr. President of the Assembly, Mr. Director General of the WHO, distinguished dignitaries. In the context of COVID, we all are passing through a challenging time with many risks and uncertainties. On behalf of the Government of Nepal, I would like to express high appreciation and sincere gratitude to the frontline health workers for their untiring effort in COVID response. Diseases such as COVID have no boundaries. Neither they discriminate people based on color, class, and group. Hence, it is our collective responsibility to fully secure health rights of people across the globe. From the outset, Nepal has been responding to the COVID outbreak with high-level political commitment and mobilizing multi-sectoral mechanisms. While Nepal is institutionalizing federalism, the ongoing efforts to respond to this epidemic from the three tiers of government have been instrumental. In Nepal, number of infected people is in increasing trend. It is therefore the upcoming days can be further challenging for us. In addition, it has further emphasized the need for resilient and responsive health systems and sustained level of in-country production of medical goods and services. The effort on the COVID response from WHO and other national and international stakeholders have been commendable. It has further proved the historic role played by these organizations in protecting human health. I would like to emphasize the need for unified efforts by the member states for universal health security. Finally, I wish for the successful deliberation of this Assembly, which is being conducted with the use of available advanced technologies, despite several limitations. Thank you and namaskar.
Thank you, Minister. I now give the floor to Guyana, to be followed by Afghanistan. Not Cameroon, by Afghanistan. So Guyana, you have the floor, followed by Afghanistan.
Warm greetings from the government of the Cooperative Republic of Guyana and the Ministry of Public Health to all member states of the World Health Assembly. Guyana wishes to congratulate the WHO and the Secretariat for its stewardship over the past few months of the COVID-19 pandemic. For all countries, and especially for low and middle income countries, this stewardship has been priceless. Guyana calls for continuing the global solidarity and coordinated responses that will contribute to finding solutions soonest and thereby reduce the social and economic impacts and insecurity resulting from the pandemic. The importance of strengthening and expanding primary health care and routine immunizations should remain on the agenda as we work to prioritize prevention and preparedness at national and global levels to mitigate the effects of COVID-19 and future health challenges. Guyana wishes to underscore the need to speed up the development and production of treatments and vaccines, and to ensure equitable access and distribution in a timely manner as these become available. Finally, Guyana recognizes the importance of human resources and calls for greater investments in this area, especially in strengthening the capacity of our first responders. Guyana continues to strengthen its emergency response capacities across the country to mitigate the spread and effects of COVID-19 and reiterates its appreciation of WHO's coordination and global leadership to the pandemic. Thank you.
Thank you, Minister. I now give the floor to Afghanistan, to be followed by Iraq. Afghanistan, you have the floor.
Fighting against requires a coordination by regional and global. It is the time to further the HR plan from partners for effective management of public health emergencies. One of the major challenges is to maintain progress in the face of increasing instability, violence, and rising poverty. Maternal mortality remain unacceptably high. The coverage of population is suboptimal mainly in areas. Both public and government health remain low. The country continues to suffer an increasing burden because of armed conflict, which contributes to the mass population displacement. Likewise, police are facing numerous challenges, such as growing restrictions implementing house-to-house campaigns. The situation is being more and worse due to the postponement of the vaccine campaign. Attack on healthcare programs and health facilities in Afghanistan continue to remain a major concern. I am sure you are aware of the recent attack on a maternity hospital in Kabul, which took the lives of many mothers. In this incident, we lost one brave midwife of who delivered critical health care. My thoughts and sympathy are with the families of grief. Finally, COVID-19 disproportionately and conflict zone, making them extremely vulnerable with now more than ever demands peace in the region. In order to overcome the challenges as a fragile and low-income country will count on continued support during this difficult time. My passport for us, COVID-19 is not only a challenge, but an opportunity as well. It helps us detect our undetected capacity, resilience, and hope for goal and success. I thank you.
Thank you, Minister. I now give the floor to Iraq, to be followed by San Marino. Iraq, you have the floor. Iraq, it seems you are connected, but we can't hear you. Can you please turn on your microphone if it's muted? Iraq, you have the floor. Okay, we'll move on and we'll come back to Iraq later. I now give the floor to San Marino, to be followed by Namibia. San Marino, you have the floor.
Okay. Madam President, Mr. Director General, dear colleagues, my country has been dramatically affected by the coronavirus. When we registered the first case at the end of February, our only hospital had no isolation wards, and only had 6 intensive care units. Now we have 80 beds in the isolation wards and 20 in the intensive care. On April 7, we began serological screening of the entire population, starting with the health workers and the police forces involved in the operation. Then moving on to the family of infected people, and finally we started screening workers. To date, our country has carried out almost 4,000 molecular swabs and more than 7,000 serological tests on its population, counting only 34,000 inhabitants, and on cross-border workers from neighboring Italy. The contagion in the family circles of those who have been sick is 15–20%, while in the rest of the population we register much lower percentage, close to 1%. We are confident that the epidemiological investigation and the tests which we intend to do on the entire population will be of great help in understanding the phenomenon we are facing. This health crisis immediately turned into an economical crisis. The inability to have access to European funding exposes us to an unprecedented crisis. We therefore hope that channels of solidarity can be opened as soon as possible, including by the WHO, within which our country has largely contributed over the years in the coordination as co-leader of small countries. I would like to address my heartfelt thanks for his support, most of all to Mr. Kluge, WHO Regional Director. Thank you.
Thank you, Minister. I now give the floor to Namibia, to be followed by Sierra Leone. Namibia, you have the floor. Namibia, you have the floor.
The camera. Yeah.
We can hear you, Minister. Please go ahead, Excellency.
Thank you very much. The 7th session of the World Health Assembly is taking place at a time when the world is devastated. We express our most sincere and heartfelt condolences to the loved ones who have succumbed to COVID around the world. Further, I wish to commend the and the Secretariat for convening the meeting during this time. Your sterling work, the WHO excellent report to countries globally to respond to COVID-19 pandemic are truly commendable. Namibia calls for increased support to the enable it to provide assistance, coordinate the distribution of commodities, as well as effectively response. We further aid that they should be empowered by its member states to ensure that all technologies the pandemics are treated as not goods. Madam President, Namibia recorded positive cases on the 1st of March 2020. We have since recorded 16 cases. The last case recorded on the 5th of April 2020. The majority of were imported, with 3 cases recorded as transmission. Out of the 16 cases, 13 have fully, but the past days, with no new cases. We are fully aware we cannot relax. We must continue to prevent the spread.
in our country. The risk of importation of virus Namibia vehicular is one of the main. It is thus critical, stronger coordination and synchronization of response intervention, especially for. I thank you.
Thank you, Minister. I now give the floor to Sierra Leone to be followed by Nauru. Sierra Leone, you have the floor.
Yes, can you? Let me sincere greetings from His Excellency the President to the leadership of WHO. Let me also say that Sierra Leone was exposed to the Ebola scourge from 5 years back. That experience made us not a bit more prepared, but one that was ready for the challenge. This was led by His Excellency the President. All the basic tenets of hand washing, of social distancing, of using the mask as well. All of that started very early in the year. And the National Policy Agency decided to create an autonomous entity described as the National Response Team to COVID-19. That team activated the 7 disease pillars, that of surveillance, laboratory, case management, food and nutrition, psychosocial, and quarantine. We set out to ensure that we screen those entering into the country. We also set out to quarantine those that have exposed to the disease or from countries that have registered more than 50 cases. We were, I would say, the last country to register the disease in West Africa. We had something like the first case coming up the 31st of March. Now it is with us. We expanded our testing. We did that with PCR fluorescence methodology. Currently, we have tested well over 4,000 people, but the positivity number is 519 as at today, the 18th of March. Of that number, 148 now left the hospital. We believe they are free of the disease. That indeed is a good mark, but we have lost 33. Of those, 17 happen to have occurred outside of the treatment center, reflecting some weakness in the health system. We've gone through the issues of closing down the country for 3 days. We have shut down schools, we've shut down churches, and nowadays we now experience that we are getting other things coming up. Gender violence, rape, mental health issues. Well, it is clear to us that we will not have been able to attain as much as we have without the support of various agencies, Africa CDC, WAHO, DACMA Foundation, the World Bank Global Fund, Islamic Development Bank as well. But it is clear to us that the intervention have to be health system strengthening. I thank you very much.
Thank you, Minister. I now give the floor to Nauru to be followed by Mauritius. Nauru, you have the floor.
Nauru continues a strong push in preparedness and response against the introduction of coronavirus as multi-sectoral governments, private, donor support and regional technical advising work in collaboration. This is in close alignment with the Pacific Humanitarian Team COVID-19 Humanitarian Response Plan. Seeing how easily COVID-19 has overwhelmed the health systems of some of the countries with strong health sectors, Nauru has taken a strategic zero-tolerance approach of catch and contain, as we cannot afford local transmission that could overwhelm our resources. We have two levels of framework of phased strategic response plans under recurrent declared state of disaster. The first is a coordinated national all sectors response plan. The second is a health sector specific surge capacity. We need to undertake the following steps to mention a few. 1. Border health travel advisories and restrictions of direct entry. 2. Compulsory screening at our ports of entry. 3. Dedicated transition facilities to quarantine travelers for 14 days. 4. Ongoing setup a new state-of-the-art CCU with 18 beds for confirmed coronavirus cases requiring hospitalization. 5. Rolling out of PCR testing. To close, COVID-19 pandemic remains one of the most challenging tasks we are dealing with, and Nauru acknowledges the continued support of our partners, especially Australia and the Republic of China, Taiwan. The success of the Republic of China, Taiwan in dealing with this crisis cannot be ignored. We need to harness inclusivity and global cooperation at this level more than ever to defeat this pandemic. Wishes to render its full support the draft resolution COVID-19 response. Thank you.
Thank you, Minister. I now give the floor to Mauritius, to be followed by Egypt. Mauritius, you have the floor.
Yay! 3 seconds, Megan. 3.
Mauritius, you have the floor after the clapping by Nauru.
Director General, distinguished delegates, Madam President, allow me to congratulate you on your election as chairperson of the 73rd World Health Assembly. It gives me great pleasure to address you all. Mauritius aligns itself with the statement of the African group. Our first cases of COVID-19 in Mauritius date back to the 18th of March. Immediately, entry restrictions in the country were consolidated. Normal passenger flights were suspended. Our Prime Minister chairs the high-level committee on COVID-19, initiated a nationwide sanitary curfew as from the 20th March. These bold measures have proved to be capital in their ability to cut down the risk of a major outbreak. In all, we have registered 332 COVID-positive cases. We have sadly registered 10 deaths, and 322 have recovered. Sanitary curfew should remain in force till the 1st of June. However, essential activities have resumed fully. For the last 21 days, Mauritius has not registered any new COVID-19 positive case, but we continue to remain vigilant. Madam President, I thank the World Health Organization for its unflinching support. It should also be highlighted that developed and friendly countries help us by assisting our nation with donations and capacity building. The government of Mauritius has also worked relentlessly to get necessary medical equipment and medicine in a context where connectivity between nations remains challenging. I also pay tribute to the people of Mauritius and all our stakeholders who collaborated to stop the spread of the disease. Thank you very much.
Thank you, Minister. I now give the floor to Egypt, to be followed by Cabo Verde. Egypt, you have the floor.
يا رب نسعى أن تكون الجهود الإنسانية التي قامت بها سكرتارية المنظمة العالمية بالتعاون مع أعضاء في هذه الدورة الافتراضية، وذلك لأول مرة في تاريخ جمعية الصحة العامة العالمية. كما نعرف عن الدوران العميق والبارز من منظمة الصحة العالمية ومديرها العام تدرس أدهم في قيادة الاستجابة العالمية لجائحة كوفيد-19 وحشد الدعم من جميع الدول للتعامل مع الأزمة الحادة التي تؤثر على الصحة العامة والأوضاع الاقتصادية والاجتماعية. كما نؤكد عزمنا مواصلة التعاون مع المنظمة لتمكينها من القيام بدورها في هذا المجال على الوجه الأكمل. السيدة الرئيسة، لقد أكدت الأزمة الحالية الحاجة الماسة لتعديل الأولويات فيما يتعلق بالصحة العامة حول العالم، وأهمية الاستثمار في جوانب الوقاية والتأهب لمواجهة الأوبئة، فضلاً عن تعزيز الرعاية الصحية الأولية وتحقيق التغطية الصحية الشاملة، مع أهمية توجيه الجهود نحو دعم النظم الصحية في الدول منخفضة ومتوسطة الدخل، والتي تفتقد أغلبها للإمكانيات الأساسية اللازمة لاستجابة الأوبئة. ولا يفوتنا أن نشيد مجددا الجهود الضخمة التي تقوم بها المنظمة بتوفير الإمدادات من أدوات ووسائل الوقاية وأجهزة الكشف والتشخيص من خلال قيادات المبادرات الدولية في هذا الشأن، لا سيما محدودية هذه الأدوات لدى العديد من الدول النامية والأقل نمواً والعجز العالمي الحالي في سلاسل التمويل، علاوة على التأثير السلبي للإغلاق العام وبطء النقل الدولية. السيدة الرئيسة، لقد قامت مصر منذ ظهور أول حالة إصابة في البلاد بواسطة أحد المسافرين باتباع عملية مجتمعة للرصد المبكر والتقصي والتتبع والعزل والحفظ الصحي في كافة محافظات الجمهورية ونقاط الدخول المختلفة للسيطرة على انتشار الفيروس، وذلك في إطار خطة تأهب متعددة القطاعات ضمن جميع الوزارات المعنية تحت إشراف مباشر من السيد الرئيس عبد الفتاح السيسي، جنبا إلى جنب مع وضع حزمة من التدابير والإجراءات الخاصة بتخفيف آثار انتشار الفيروس على الأوضاع الاقتصادية والاجتماعية من دعم الفئات التي تضررت من جراء ذلك المناخ، خاصة التي تعتمد على كسب أرزاقها بشكل يومي. لم تقتصر جهود الحكومة المصرية على مكافحة الفيروس على المستوى الوطني، ولكن كذلك كانت على مستوى القارة الأفريقية في إطار ثوابت السياسة الخارجية المصرية تجاه القارة وشعوبها. في النهاية، تتطلع مصر لاستمرار التضامن والتعاون الدولي للقضاء على الفيروس في إطار النظام الدولي متعدد الأطراف تحت قيادة منظمة الصحة العالمية، ونشدد على ضرورة المنظمة والمجتمع الدولي جهود إنتاج وتوفير تكنولوجيا الصحة العامة والأدوية واللقاحات وتوزيعها بشكل عاجل وعادل ومنصف على جميع الشعوب وإزالة أي عوائق التحويل دون تحقيق ذلك. شكرا لسيادتك.
Thank you, Minister. I now give the floor to Cabo Verde, to be followed by Belize. Cabo Verde, you have the floor. Cabo Verde, you are connected and you can now make your statements. Please unmute all microphones and go ahead. Thank you.
Madame la Présidente, Monsieur le Directeur général, au nom du gouvernement de Cap Verde, nous adressons à la présidence de la 63e Assemblée mondiale de la santé votre soutien dans la conduite des travaux et d'excellents résultats. Au directeur général de l'OMS, notre reconnaissance son orientation âge et décisive à une époque de grands défis mondiaux. Cette Assemblée mondiale a marqué, même dans son histoire, par les profonds.
Excellency, apologies. We have some interpretation issues. Can I ask you to start again slowly so that the sound quality can come through a little bit better for us? Apologies. Please start again. Thank you.
OK. Monsieur le Président, Monsieur le Directeur général, au nom du gouvernement de Cap-Vert, nous adressons à la présidence de la 14e Assemblée mondiale de santé veut de succès dans la conduite de travaux et d'excellents résultats. Au directeur général de l'OMS, Dr Tedros, notre reconnaissance pour son orientation sage et décisive à une époque de grands défis mondiaux. Cette Assemblée mondiale sera marquée, même dans son format, par les profonds impacts de la pandémie SARS-CoV-2. Monsieur le Président, sans vaccin contre Covid-19 et sans traitement spécifique, il n'est pas possible de prédire le fin de cette pandémie ou de calculer sa véritable dimension. Malgré le nombre effrayant de vaccins et des décès déjà causés, nous ne pouvons malheureusement reconnaître le début d'une réalité potentiellement catastrophique, surtout si je nous ajoute les effets négatifs que la pandémie aura sur le contrôle d'autres maladies prioritaires, telles que les maladies chroniques non transmissibles, les maladies oncologiques, la transmission de vecteurs, tels que les produits, la dengue et la fièvre jaune, ou même ceux évitables pour la vaccination. Madame la Présidente, les Cap-Verts sont un groupe de petits États insulaires avec une population d'un peu plus d'un demi-million d'habitants. Il fait face à 3 années consécutives de sécheresse, ce qui pose des défis supplémentaires sur la sécurité alimentaire et l'approvisionnement en eau des populations. Sans ressources naturelles, le Cap-Vert a dans les secteurs touristiques les principaux moteurs de développement économique. Jusqu'à la pandémie, le pays recevait 1 million de touristes par an. Depuis l'annonce de notre gouvernement, le gouvernement a commencé à prendre des mesures d'anticipation visant à empêcher l'entrée de notre virus, mais aussi à la contenir et à l'atténuer. Les premiers cas d'infection ont été diagnostiqués à 19 mars 2003. Depuis lors, seulement 3 sur les 10 îles de l'archipel ont enregistré des cas, soit un total de 300 cas confirmés et 95 découvertes et 3 décès. L'infection reste active et ne phase de propagation uniquement à Santiago et notamment à Healt, la capitale du pays. Monsieur le Président, la paralysie du secteur touristique, le manque de diversification économique impacte directement les ressources indispensables à la gestion du pays. Comme conséquence de Covid-19, le déficit budgétaire passera de 3% à plus de 10% du PIB en 2020. Mon pays, comme le reste du PIB, est préoccupé par l'accès de plus en plus limité aux marchés internationaux et la diminution du système financier mondial, ainsi que par le niveau élevé de la dette, dans un contexte de croissance et de pression sur les finances publiques. C'est dans ce contexte que le gouvernement met en œuvre un plan pour répondre aux besoins de santé, atténuer l'impact socio-économique à court terme.
Minister, Your Excellency, you have run short on time, unfortunately, and we have to move forward. So on behalf of Madam President, I will be moving forward with the next intervention by Belize, to be followed by Cameroon. Belize, you have the floor.
Belize conveys congratulations to the Bahamas in assuming the presidency of this assembly, as well as to the Director General, whose resolute leadership is steering us through unprecedented times. No country has been spared as the COVID-19 pandemic damages health systems, economies, and livelihoods around the world. Belize mounted an early all of government and all of society response, based much on public health advice from the WHO, of regional organizations, and of regional friends such as the Republic of Cuba. Belize has only had 18 cases, 2 unfortunate deaths, and 16 cases now have fully recovered. Today, Belize is one of the few countries in the world that is currently free of COVID-19. More than ever, we need an enhanced all-world response to maintain global supply chains for effective surveillance and for equitable, affordable access to medical supplies, including for a vaccine. In Belize, as everywhere, the pandemic also compels us to redouble our efforts to combat the global epidemic of NDCs and to maintain climate change goals high on our collective agenda. My delegation holds the position that Taiwan's exclusion from the World Health Organization represents a break in the global health system that can undermine the Taiwan has lessons to share from its COVID-19 success. Belize again calls for Taiwan's meaningful participation in the World Health Organization and for its observer status in World Health Assemblies. Finally, Belize joins in saluting our health workers around the world, and we reaffirm our strong support for the UN system and for the WHO in the continued coordination of a comprehensive multilateral response to the pandemic. Thank you.
Thank you, Minister. I now give the floor to Cameroon for a group statement on behalf of the African Group of Ambassadors, to be followed by Iraq. Cameroon, you have the floor.
Madame Présidente,
Cameroon, we seem to have lost you. Are you there? Please start again. Okay, we'll come back to Cameroon in a little while. I'll now move to Iraq, followed by St. Lucia. Iraq, you have the floor. Okay, so we'll come back to Iraq. There you go. Iraq, if you can hear me, please, you can start your statement. Thank you. No? Okay, so Iraq a bit later. I now give the floor to St. Lucia. St. Lucia, you have the floor.
Mary Isaac,
I now
Minister
give the floor
for Health
to
and
St.
Wellness,
Lucia.
St. Lucia.
St. Lucia,
the government
you have the
and
floor.
people of St. Lucia would like to thank all agencies who have assisted us in combating the novel coronavirus. When WHO advised all countries to ensure preparation for containment as a result of the dreaded coronavirus, the Department of Health and Wellness in St. Lucia prepared for the worst-case scenario and immediately sensitized key stakeholders and the public to ensure early detection and efficient management of COVID-19. To facilitate quarantine and isolation of persons identified through contact tracing and those returning from high-risk COVID-19 areas, 5 public health facilities were established in hotels.
I now give the floor to St. Lucia. St. Lucia.
Today, 900 persons have undergone quarantine. All agencies. We have had 18 positive cases of COVID-19 in St. Lucia, 2 of whom were repatriated. When WHO advised all local countries to ensure preparation for containment As a result of the second time during this pandemic that the Department of Health and Wellness in St. Lucia prepared for the worst-case scenario and immediately sensitized the government and people of Taiwan were instrumental in donating thousands of medical masks to St. Lucia. In April 2020. To facilitate quarantine and isolation, we applaud the ability of Taiwan to contribute thousands more to the United States from high-risk United Nations territories and member states. 5 public health facilities were established in hotels, Latin American countries,
to St. Lucia. St. Lucia.
It is important to note that as of April 29, we have had 18 positive cases of COVID-19 in St. Lucia, novel coronavirus, whom were repatriated. When WHO advised all countries.
St. Lucia, apologies. There seem to be some technical issues there. We will replay in a minute. We will now move to Iraq. Iraq, I hope you can hear us. You have the floor. Okay, we'll move on and go to, now we'll go to Guatemala to be followed by St. Vincent and Grenadines. Guatemala, you have the floor.
Señor director, ministro, señora presidenta, yo vengo a certificado del presidente de la República, el doctor Alejandro, 62 meses, y con su conocimiento, articuló todas las capacidades, seguridad, dando con esto y mitigación para la población y resguardar en esta lucha nos enfrentamos mundial de acción personal el valioso la organización y a la organización para continuar mediante así también incluir a todas la lucha contra el mal, así como destacando la valiosa política de China a desarrollar tanto en la situación, pero veo mi país como la Asamblea, así como la y actividades. Guatemala ha recibido ante esta generada. Consideramos aliados en materia de solidariedad. Quiero hacer a todos y a los organismos que nos han. Gracias, señor. Muchas gracias.
Thank you, Minister. I now give the floor to St. Vincent and Grenadines to be followed by Rwanda. St. Vincent and Grenadines, you have the floor. St. Vincent and Grenadines, you have the floor. You're connected. You can start your statement now. Thank you. Please proceed, Minister. You have the floor. Apologies, you're still muted. We cannot hear you. Okay, we'll have to come back to you. Let's move to Rwanda. Rwanda, you have the floor.
Madam Chair, Director of WHO, distinguished delegates, good evening. First of all, I would want to express my condolences to families who lost their loved one with COVID-19. The government of Rwanda is pleased to participate in this 73rd WHO Assembly. Indeed, it is an opportunity to deliberate on the issue distressing our health systems, especially at this critical time of COVID-19. This situation is a wake-up call to the world to realize that it is inevitable to invest in our health sector than never before. Rwanda considers the primary health care approach as one of the most vehicles for achieving universal coverage. Through this approach, Rwanda reinforced a people-centered, integrated, and sustainable health care in order to ensure quality, essential health care service as close as possible to the community. In order to meet this obligation, we must hold ourselves answerable to providing equitable, affordable care services for our people. We must promote and support values of efficiency, accountability in order to achieve sustainable and resilient health systems. In time like this, where the whole world is struggling to overcome COVID-19, it is imperative to have a global solidarity and collaboration to strengthen partnership in sharing information and expertise that will aid government to make informed decisions to contain COVID-19. Rwanda will continue to build a resilient health system that is adaptive to changes, new demands, and new stresses such as COVID-19, Ebola, and other epidemic emergencies. It is therefore important to maximize community engagement, respond to health issues, adopt healthy behavior and lifestyle, and conduct regular wide consultation with all stakeholders. Allow me, Madam Chair, to conclude by commending the work, effort, and courage expressed by WHO leadership at all levels during this COVID-19 multi-sectoral crisis. We are more than grateful for all your help and sacrifice in fighting this unseen enemy, and we honor your dedication to save lives. Thank you so much.
Thank you, Minister. I now invite Burkina Faso to the floor, to be followed by Iraq. Burkina Faso, you have the floor.
Monsieur le Président, Mesdames et Messieurs, c'est un honneur pour moi de prendre la parole au nom du Burkina Faso devant cette auguste assemblée qui se réunit dans des circonstances particulières imposées par les contingences de la COVID-19. Je voudrais, au nom du gouvernement du Burkina Faso et à mon nom propre, féliciter le président de la 73e Assemblée mondiale de la santé pour sa brillante élection et remercier M. Tedros, directeur général de l'OMS, pour ses efforts inlassables d'amélioration de la santé des populations. Monsieur le Président, Mesdames et Messieurs, le Burkina Faso, à l'instar d'autres pays du monde, est confronté à la crise sanitaire provoquée par la COVID-19 dont le corollaire d'impact compromet gravement son développement. Cette crise, qui survient sur un tableau national déjà fragilisé par un contexte sécuritaire éprouvant, nous interpelle et pose la problématique de la résilience des systèmes de santé des pays comme le nôtre. En effet, tout comme dans de nombreux pays, la question de la préparation et de la riposte à la pandémie de la COVID-19, thème principal de cette session, se pose avec acuité au Burkina Faso. C'est pourquoi mon pays s'engage d'ores et déjà à tirer profit des propositions de résolution qui sortiront de cette Assemblée pour une meilleure riposte à la COVID-19 et au-delà pour un renforcement de la performance de son système de santé. Je voudrais terminer mon propos en appelant à la coopération et à la solidarité internationale pour mettre fin à cette pandémie dans de meilleurs délais. Je vous remercie.
Merci, Madame la Ministre. I now give the floor to Iraq, to be followed by Cameroon. Iraq, you have the floor. Okay, so Iraq will need to come back to you. I will now move forward and invite Cameroon to the floor for the regional statement. Cameroon, you have the floor. Minister, Cameroon, we cannot hear you. Please try again. I'm sorry, apologies, we still have no sound. We'll have to come back to you yet again. I will move forward and invite Nicaragua to the floor, to be followed by Libya. Nicaragua, you have the floor. Nicaragua, you have the floor. Please proceed. Nicaragua, unfortunately we can't hear you. Could you kindly check sound on your end and then please proceed? Apologies, Nicaragua, we're having some issues, so we'll come back to Iraq, Cameroon, and Nicaragua later. We will now give the floor to the Czech Republic. Czech Republic, you have the floor.
President, Director General, distinguished delegates, ladies and gentlemen, the Czech Republic fully aligns itself with the statement of Croatia delivered on behalf of the European Union. More than ever, it is an honor to have this opportunity to address the World Health Assembly. This very difficult year is designed the International Year of the Nurse and the Midwife. This is the reason why I would like to start by expressing my personal and sincere gratitude for their tireless efforts and work during days and nights in taking care for COVID-19 patients around the world. After years of paying attention to NCDs, now we have been reminded that infectious disease outbreaks and epidemics represent a significant health threat. COVID-19 took the international community by surprise. To avoid the most of these surprises as possible for future, I stress the importance of independent and comprehensive evaluation of the WHO and international community reaction on COVID-19 pandemic outbreak. Since building resilience at all levels is a key factor in preventing disease, protecting and promoting health in everyday life of each community, the Czech Republic continues to support health systems and fight against diseases around the world as part of its bilateral development assistance and its multilateral cooperation. I would like to make an appeal to political representatives and the WHO not to turn away from the principles of solidarity. The international community should reiterate its commitment included in the SDGs to leave no one behind. Each and every country in the world has to be provided by the adequate support. We must continue to share our experience with everybody who is interested and to learn from all those who have expertise. I believe the WHO should serve as a platform for this exchange. Thank you very much for your attention.
Thank you, Minister. I now give the floor to Hungary, to be followed by Greece. Hungary, you have the floor.
Dear Director General, dear ministers, ladies and gentlemen, it is my great honor to share this meeting with you, and I fully appreciate that the WHO brought this together under the scope of COVID pandemic. We also appreciate the WHO effort to help us all to control the spread of this disease. And we also appreciate the WHO Solidarity Trial. Here in Hungary, we started our preparation at the end of January when the first case appeared in Europe. We took the threat of the disease very seriously and we acted upon it. We wanted to save lives, we wanted to prevent healthcare from overpressure, and also we wanted to flatten the curve to enable the country to return to normal everyday life as soon as possible. Now, at the beginning of May, we're happy to say that yes, it is indeed what happened. We saved lives. The healthcare is in operation. It had enough capacity, and the country is getting the doors open to new life. We do hope that during the summer we can prepare ourselves for the coming fall, and we rely on the solidarity, on the participation of the other countries as well. I hope that we can do it together, and here and now, thank you to all of you for making it a success of the human being. Thank you very much for your attention.
Thank you, Minister. I now give the floor to Greece, to be followed by Panama. Greece, you have the floor.
Dear President, dear Director General, Ministers, Excellencies, Greece fully supports the statement made by Croatia in the EU presidency on behalf of the EU and its member states. In the battle against the unprecedented pandemic of the coronavirus, we have joined forces with science, solidarity, philanthropy and patriotism being our weapons. In order to protect our fellow citizens, but above all the vulnerable groups, our success is primarily attributed to the excellent healthcare professionals of our national health system. To those everyday heroes, doctors, nurses, administrative and paramedical staff, and the personnel of the National Center of Emergency Assistance, the scientists and the staff of Hellenic National Public Health Organization, who successfully undertook the tracking of the first case. From the very beginning, we have been in continuous contact with the World Health Organization and the European Crisis Disease Center. We have designated 13 reference hospitals across the country. We have conducted more than 30 preparedness exercises under the coordination of the National Center of Emergency Assistance. We entrusted the experts and appointed a scientific committee of experts. The first case of coronavirus appeared in Greece on February 26th. On the same day, following an order from the Prime Minister, I announced the postponement of the carnival events, and on March 10th, the suspension of the operation of all educational facilities. On March 22, the Greece's Prime Minister Kyriakos Mitsotakis proceeded to a general lockdown. Our plan started from the intensive care units. We increased intensive care beds from 565 before the crisis to 1,017. Hirings. We have strengthened the NHS with more than 4,000 healthcare professionals. PPEs. We have organized an unprecedented supply bridge amid global dispute regarding the medical material. Donations. We have received donations of 865 organizations amounting to 89 million euros. As the pandemic is not over, I strongly believe that we have to act all together with solidarity. Solidarity is not just a word. It is a value, it is a principle that must govern the world, especially in times of unprecedented crisis. Under this light, Greece fully supports the resolution proposed by the EU on the COVID-19 response, hoping in a prompt, positive perspective concerning medicines and vaccines. I urge to support the health in all policy strategy in order to ensure that no one is left behind. Thank you very much for your attention.
Thank you, Your Excellency. Ahora invitamos a Panamá. Distinguido ministro, tiene la palabra.
Ministerio de Salud de Panamá y de la señora ministra Rosario Turner, queremos darle un saludo a todos los que están participando en esta conferencia. Queremos iniciar nuestras palabras no solamente lamentando las pérdidas de vidas durante esta pandemia, sino también enviando un saludo y una felicitación a todos los miembros de los equipos de salud que a nivel mundial están dando su cuota extra en este momento. Panamá, desde el día 9 de marzo, reportó su primer caso de COVID-19. Desde entonces, venimos haciendo ingentes esfuerzos en el control y mitigación de esta pandemia. Pero empezamos mucho antes a través de las salas de situación y activando los equipos de epidemiología. En ese sentido, hemos establecido una serie de tareas que estamos cumpliendo con el mayor ahínco y con el mayor responsabilidad e integridad que el sistema de salud y la población panameña se merece. Le damos las gracias por esta oportunidad, saludamos a todos los países que en este momento están como nosotros, trabajando arduamente por el control de esta pandemia. Somos conscientes de que la solidaridad y el apoyo mutuo son los pilares fundamentales para salir de esta epidemia. Nuevamente damos las gracias por la oportunidad en nombre del Gobierno Nacional, el Ministerio de Salud y un saludo muy especial de la señora ministra Rosario Turner. Muchas gracias.
Gracias por su intervención. Nos invitamos a Nicaragua, Bolivia. Bolivia tiene la palabra.
A nombre de nuestra presidenta, señora Yanine Áñez Chávez, deseo hacer llegar un afectuoso saludo a todas las autoridades del Secretariado de la Organización Mundial de la Salud y a los 191 ministros que componen los cuerpos directivos. Desde el 7 de abril de 1948, la Organización Mundial de la Salud se constituye en el máximo organismo de salud pública internacional, trabajando para promover mejores estados de salud y niveles de vida en los pueblos del mundo. Al reunirnos en esta oportunidad, en esta 73ª Asamblea, nos damos cuenta del valor de la OMS para liderar los esfuerzos regionales y mundiales. Todos estamos enfrentando una de las pandemias más duras que vivió la humanidad, con millones de personas enfermas, miles de fallecidos y un sinnúmero de efectos en lo social y económico. Viviendo con el COVID-19 estamos mostrando el verdadero valor de la salud para desarrollar el bienestar de nuestros pueblos y nos está enseñando que los gobiernos y los organismos internacionales de salud debemos preocuparnos más y mejor por desarrollar sistemas y servicios accesibles a toda la población. Agradecemos a la Organización Mundial de la Salud por el trabajo mancomunado en sus oficinas regionales, buscando la solidaridad en torno a la salud de los pueblos y generando oportunidades de colaboración. Debemos rescatar la importancia de la atención primaria de salud como fuerza vital para las personas con la participación activa de las comunidades en responsabilidad compartida con sus autoridades. Valoramos la dedicación de los médicos y personal en salud que trabajan intensa y esforzadamente en la atención a todos los afectados por el coronavirus. Hacemos un homenaje póstumo a quienes sacrificaron su vida para salvarla de sus prójimos, así como de las personas que sufrieron la enfermedad y perdieron la vida. Anhelamos un mundo mejor y proponemos una acción de todos por la salud y la vida. Gracias.
Thank you, Minister. And we now invite Nicaragua to be followed by Libya. Your Excellency, you have the floor.
Thank you. Mr. President, representatives, receive a warm greeting from the people and government of Nicaragua as we continue the society, peace, and reconciliation. Prioritize law. Nicaragua, facing its sovereign right to make its own policy. In accordance with
Your Excellency, I apologize. We have technical problems. We cannot hear you well. We propose to go further with Libya, and we will try to... Your Excellency? Your Excellency, I apologize. We have technical issues and we cannot hear you well. Let us continue with Libya and we will come back to you while our colleagues work on the issue. Libya, you have the floor.
Okay. Thank you, Chair, Excellencies, colleagues. Libya aligns itself with the statement given by Tunisia on behalf of the Emir States. Libya supports the WHO efforts and guidance. We stand in solidarity, starting by giving our gratitude and support to all healthcare workers across the globe. As an identified high-risk country, we appreciate the assistance and cooperation of the WHO and member states to help Libya face its challenges. Libya faces a serious public health threat in a most challenging way. For our health system is not resilient, and although we are working closely with WHO on all measures to implement the pillars of COVID-19 strategic preparedness and response plan to mitigate the potential consequences of this pandemic, with good coordination to expand testing and tracing, to identify cases and strong measures for repatriated citizens. However, we have concerns for our healthcare system is burdened and stretched by the ongoing armed conflict, which has diminished the resources, especially in the most vulnerable areas, and left hundreds of thousands of civilians displaced and in dire situation where they have to choose between leaving their homes to run away from war or staying at home to run away from COVID-19. Libya stands ready to strengthen its collaboration with WHO, its partners, and member states to speed the global recovery. In order for that to happen, for us to get back on track to the universal health coverage targets, we need to invest in strengthening health security and human rights in each and every country, as health is a core human right. Libya's health security will in turn impact directly the economic stability and prosperity of our neighboring countries in Africa and the region. The response to COVID-19 is an all or none that requires commitment, strong international cooperation, fairness, in order for us to save human lives and dignity. Thank you.
Thank you, Your Excellency. We will try Nicaragua again. Distinguished Minister, do you hear us? Let us also try Cameroon. Your Excellency, can you hear us? We will try connecting Sudan. Minister, you have the floor. We would like to invite the Dominican Republic. Your Excellency, you have the floor.
La pandemia del COVID-19 ha sido un gran reto para toda la humanidad, un reto importante para todo el sistema de salud, para las comunidades, las familias y los gobiernos. Los líderes mundiales han hecho y continúan haciendo todo lo mejor que le es posible a cada país para salir adelante en esta crisis mundial. La República Dominicana no ha sido una excepción y su economía y su vida social también se han visto afectados en esta dirección. Igualmente el sistema de salud, a la fecha con cerca de 12.000 casos y 424 fallecimientos en edades básicamente de 65 años en promedio, hemos sido capaces de mantener una ocupación hospitalaria rondando el 40% como un buen balance entre el efecto de la demanda sanitaria y la capacidad del sistema para operar. Igualmente debemos decir que la República Dominicana necesita aumentar sus capacidades en materia de gestión, control y mitigación de desastres, así como el uso e incremento de la tecnología para trabajar estos grandes desafíos que se van presentando. La unidad es un factor clave para enfrentar esto. Todos juntos, comunidad, familia, gobiernos, políticos y religiosos, tienen la capacidad para dar respuesta a este fenómeno. La Organización Mundial de la Salud y la OPS han prestado servicios importantes a nuestros países que debemos agradecer.
Thank you, Your Excellency. We would like to invite Japan to be followed by Eswatini. Apologies. We will introduce Senegal first. Your Excellency, you have the floor. We would like to invite Eswatini to take the floor, to be followed by Mongolia. Your Excellency, you have the floor.
I have the honor to speak on behalf of the Kingdom of Eswatini on agenda item number 3. Recent years have seen a string of international outbreaks of emerging infectious diseases such as Ebola, Zika virus, and remember clearly the human toll of the 2003 severe acute respiratory syndrome SARS epidemic. Globalization has created a clear risk of the cross-border transmission of communicable diseases. With the rapid spread of coronavirus 2019, COVID-19 across the world, it is more imperative than ever to include all relevant parties and stakeholders in combating this pandemic. WHO's continued discriminatory treatment of Taiwan has seriously compromised the organization's overall disease prevention efforts and undermined the interests of its members and endangered global health. Without timely access to critical information about COVID-19, Taiwan risks becoming a gap in the global health system, which would undermine the very purpose of WHO's existence. It is worth noting that despite its proximity to the source of COVID-19, Taiwan has prevented a major outbreak. As of May 14, 2020, Taiwan had only 440 cases with minimal community spread in a population of 23 million people. Taiwan has effectively contained the spread of COVID-19 through the timely establishment of a transparent, centralized command structure, emergency measures such as border control, case identification and containment, and the regulation of medical masks and other medical resources to ensure their fair and appropriate distribution. Acting on the conviction that Taiwan can help, Taiwan has donated millions of medical masks to the United States, EU member states, and other European nations, diplomatic allies, countries in Latin America and the Caribbean, parties under the Taiwan's new southbound policy, and other friendly nations to help provide local medical personnel with more resources to fight COVID-19 pandemic. This clearly demonstrates that Taiwan, as a professional, pragmatic, and constructive partner, could indeed contribute to WHO and global health. Allow me to emphasize that the epidemic prevention and containment transcends national borders. Countries cannot fight COVID-19 alone. As the international community endeavors to strengthen mechanisms to combat COVID-19, Taiwan stands willing and able to collaborate with other countries and is playing an indispensable role in overcoming the pandemic. Taiwan being granted full involvement in WHO and observer status in WHA would allow Taiwan to share its successful experience with the world more effectively, helping put an end to the pandemic as quickly as possible. Mr. President, the best thing we can do to prevent future outbreaks is to strengthen health systems everywhere. Leaving any one region or country out of the global health network creates a gap that undermines global public health safety. We should not allow politics to create a gap in the global prevention control network. Mr. President, in the light of these considerations, the Kingdom of Eswatini would like to reiterate our strong support for Taiwan's participation in WHO, including the observership in the World Health Assembly, based on the principles of professionalism, pragmatism, and leaving no one behind. I thank you.
Thank you, Minister. We will now invite Mongolia to be followed by Côte d'Ivoire. Mongolia, you have the floor, please.
Mr. President, Mr. Director General, distinguished delegates, I wish to start my short statement by thanking the WHO for guiding the member states in the fight against COVID-19 pandemic since early January. In particular, Mongolia thanks the WHO Regional Office for the Western Pacific, as well as the country office for the technical guidance and support in our efforts to effectively respond to the pandemic. Colleagues, Mongolia reported its first confirmed case of COVID-19 on March 10. Since then, we have had total 98 confirmed cases, all been imported. Thankfully, we have not experienced localized community transmission as of today. The government has been implementing international travel-related restrictions to control initial cases to prevent from the outbreak of localized clusters of infections through active surveillance, testing, contact tracing, and quarantine measures, supplemented by social distancing rules. The preventive and containment measures are still in effect, and this bought us more time to prepare for the outbreak of the disease. We have been working to prepare our hospitals for the surge of patients that would require intensive care beds in case of large-scale community transmission. Yet we still face shortages of supplies of biomedical and personal protective equipment, especially N95 respirators that are essential for frontline healthcare workers. Recently, the government of Mongolia has conducted a 3-day simulation exercise at the initiative of the Prime Minister of Mongolia to test our national capacity for health emergency preparedness and response. The simulation exercise helped us identify areas that need improvements and draw recommendations from the lessons learned. Mr. President, from the global developments, it's very clear that substantial domestic as well as international public resources should be mobilized for long-term investments in health system preparedness and strengthening as guided by for the future vision of the Western Pacific region. Distinguished delegates, the COVID-19 pandemic has stained all health systems in the world without distinctions. From the global developments, it's very clear that we would still be sitting on a hot stone until the world has a vaccine to prevent infections and drugs to effectively treat them. As a developing country, Mongolia would like to request the WHO and other health partners to reform their commitment to the research and development related with finding vaccines against COVID-19 and make them accessible for the low and middle-income countries to ensure that no one is left behind. Thank you for your attention.
Thank you, Minister, for your intervention. We'd like to invite now Côte d'Ivoire, to be followed by Venezuela. Côte d'Ivoire, you have the floor.
Madame la Présidente, l'Assemblée mondiale de la santé se tient cette année sous un format particulier, en raison de la pandémie liée à la COVID-19 qui ébranle le monde entier et bouscule nos habitudes sociales. En Côte d'Ivoire, depuis la survenue du premier cas confirmé de la COVID-19, le 11 mars 2020, le gouvernement s'est fortement mobilisé par l'élaboration et la mise en place d'un plan de riposte sanitaire et d'un plan de soutien économique, social et humanitaire. Sous la haute égide du président de la République, son Excellence Alassane Ouattara, des mesures fortes et urgentes ont été prises en dégageant des moyens financiers importants pour impulser la riposte, avec un dispositif sanitaire approprié pour apporter l'assistance humanitaire aux populations les plus vulnérables et pour soutenir l'activité économique. À ce jour, mon pays compte 2109 cas confirmés, dont 1004 guéris et 27 décès, soit un taux de guérison supérieur à 47% et un taux de létalité de 1,2%. Depuis le 21 avril 2020, il n'est enregistré aucun cas positif en dehors du Grand Abidjan, épicentre de la maladie, qui concentre 98% des cas confirmés recensés dans le pays et fait d'ailleurs l'objet de mesures d'isolement pour empêcher la propagation de la maladie. Madame la Présidente, la solidarité et l'unité seront les clés pour une riposte mondiale efficace contre cette pandémie. C'est pourquoi la Côte d'Ivoire appelle les États membres de l'OMS à veiller à la disponibilité et à l'accessibilité pour tous les pays des médicaments, des réactifs et des équipements médicaux nécessaires pour combattre cette maladie. De même, en raison du caractère multisectoriel des conséquences néfastes de cette pandémie, des lignes directrices doivent être prises au plan international pour permettre aux pays en développement, dont ceux de la région africaine, de dégager des marges budgétaires pour la riposte. Madame la Présidente, pour conclure, tout en m'inclinant devant la mémoire de toutes les personnes décédées en raison de cette maladie et en souhaitant un prompt rétablissement aux malades, je voudrais adresser mes encouragements à tous les personnels soignants à travers le monde et exprimer au nom de mon pays ma foi qu'unis et solidaires, nous vaincrons cette pandémie. Je remercie tous les partenaires, notamment ceux du système des Nations Unies, et je vous remercie, Madame la Présidente.
Merci, Monsieur le Ministre. We invite now Venezuela to be followed by Guatemala. Venezuela, you have the floor. We will come back, and now we want to move on to Japan. Your Excellency, you have the floor. Thank you, Japan. Your Excellency, you have the floor.
Yes, this is
画面の、画面ボールその PC で画面の動き。May I speak?
Yes, please, Your Excellency, we hear you.
Dear Mr. Chairperson, today I would like to make three points. Firstly, Japan has been promoted from early on epidemiological investigation and social distancing policies to reduce the spread of the virus. Meanwhile, observing the increase in the number of cases, Japan has declared a state of emergency on every province to implement some measures, including asking people to refrain from going out, except where absolutely necessary. The number of the newly infected patients per day has decreased. Thanks to people's cooperation with such measures that the social distancing policy has started to be gradually relaxed on May 14th. From now on, it's critically important to steadily implement the executive strategy to enhance the testing scheme and the healthcare delivery system, as well as supply therapeutic drugs and vaccines. Second, I'd like to comment on Japanese contribution to the global strategy against the COVID-19. $76 million to WTO's SPRP, $96 million to CEPI, and $100 million to Gavi. I sincerely hope that one will be used effectively to bring an end to the pandemic and improve the people's lives in affected countries as soon as possible. Thirdly, I would like to express my request for WHO the impact that this pandemic has had is immense. I would like to address the need for impartial, independent, and comprehensive evaluation to review WHO's response, as well as to identify the source of the virus and the root of the transmission to prevent the next pandemic. Moreover, it's critical to correctly mobilize all the information and knowledge available in the world to tackle the COVID-19 and to save as many lives as possible. It also has been pointed out that escalation should be given to regions which successfully embraced COVID-19 in terms of public health response, such as Taiwan. And being in a position responsible for public health measures, I would like to state we should not leave on geographical vacuums in addressing the global health issues, such as infectious disease control, which will serve the purpose to prevent the spread of infection in each country and worldwide. I want to end my remarks by reiterating that the government of Japan will continue to make every effort to put an end to this situation in collaboration with each member state and related region and organization. Thank you, Chair.
Thank you, Your Excellency. We would now like to invite Venezuela to be followed by Guatemala. Venezuela, you have the floor.
Gracias, señora presidenta. Saludos a todas las delegaciones que nos escuchan. Hasta ayer, Venezuela tenía 541 casos confirmados de COVID-19, 290 casos activos. Hemos logrado hasta ahora mantener una curva epidémica aplanada, una morbilidad de 17 y una mortalidad de 0,3 casos por millón de habitantes, con una tasa de recuperación de más del 45%. El 98% de los casos han sido asintomáticos o con cuadros clínicos leves. En la última semana hemos observado un aumento de casos procedentes de Colombia, Perú, Ecuador, Chile, y miles de venezolanos que están retornando al país al no encontrar protección social ni de salud. Cerca del 80% de los nuevos casos vienen de sus países hermanos. En Venezuela se creó una comisión presidencial para la prevención y atención de la COVID-19, dirigida por el propio presidente de la República, Nicolás Maduro. El plan se desarrolló en dos fases. La primera, antes de la aparición de casos, en la que se lanzó la campaña masiva de prevención, se elaboró el programa de decisiones, se fortaleció la vigilancia epidemiológica, se identificaron y prepararon establecimientos de salud, se elaboró protocolo de tratamiento y se capacitó al personal. Todos sabían lo que tenían que hacer. Y una segunda fase cuando aparecieron los 2 primeros casos, en la que se declaró la emergencia sanitaria y se tomaron medidas drásticas y rápidas. Cuarentena social, uso de mascarilla, distanciamiento social, prohibición de concentraciones, suspensión de actividades, despistaje masivo y personalizado a través de encuestas masivas de morbilidad, búsqueda a casos, casa por casa, y el acceso gratuito a pruebas diagnósticas y tratamiento. Igualmente, se aumentó la capacidad de hospitalización y terapia intensiva en acuerdo con el sector privado. Todas estas acciones las hemos realizado dentro de grandes dificultades económicas. Es necesario reiterar nuestra denuncia sobre el crimen que se comete contra el pueblo venezolano a través de las medidas coercitivas unilaterales, con las que se ha secuestrado a nuestro pueblo más de 30.000 millones de dólares. A Venezuela ha congelado todas las cuentas bancarias en Estados Unidos y Europa, generando dificultades en el acceso a alimentos y medicamentos. Agradecemos la cooperación humanitaria y solidaria de la OMS, OPS y el Sistema de Naciones Unidas, China, Rusia, Cuba, Irán y otras organizaciones internacionales. Para finalizar, queremos felicitar al doctor Tedros Adhanom por la extraordinaria conducción de la organización durante la pandemia, así como al presidente Xi Jinping por el manejo efectivo de la epidemia en su país. Venezuela apoya el principio de una sola China. Muchas gracias, señora presidenta.
Thank you, Your Excellency. We would like to now invite Guatemala to be followed by Mali. Guatemala, you have the floor.
Señor general, presidenta, ministros, delegados, la respuesta a la COVID-19 en Guatemala ha sido un esfuerzo unificado por el señor presidente constitucional de la República de Guatemala, el doctor Alejandro Villanueva, quien a 2 meses de haber tomado posesión y con su conocimiento de médico, articuló todos los recursos y capacidades para brindar la respuesta adecuada en salud, seguridad, alimentación, recursos financieros y mecanismos de coordinación, dando con esto un respaldo total a las acciones de contención, prevención y mitigación para proteger a la población y resguardar el desarrollo del país. En esta lucha estamos conscientes de la profunda necesidad de proteger nuestro recurso humano en salud. Nos enfrentamos a la escasez mundial de equipo y suministro de protección personal, por lo cual solicito el valioso e incondicional apoyo a la Organización Mundial de la Salud y a la Organización Panamericana de la Salud para continuar mediando en esta situación. Consideramos también muy importante incluir a todas las partes interesadas en la lucha contra la pandemia, así como en la prevención de enfermedades, destacando para ello la valiosa y eficaz labor que la República de China, Taiwán, ha desarrollado a nivel mundial, tanto en la coyuntura actual como en situaciones anteriores. Por ello, mi país ha solicitado su participación como observador de la Asamblea Mundial de la Salud, así como en las reuniones, mecanismos y actividades de esta organización. Guatemala también agradece la cooperación que ha recibido por parte del gobierno de Taiwán ante la crisis humanitaria generada por el COVID-19. Consideramos a Taiwán como un aliado estratégico en materia de salud y nos solidarizamos con ellos. Asimismo, quiero hacer extensivo el agradecimiento del gobierno y el pueblo de Guatemala a todos nuestros países amigos y a los organismos internacionales que nos han apoyado en la lucha frente al COVID-19. Gracias, señora presidenta. Gracias, señor director. Muchas gracias a todos.
Thank you very much, Your Excellency. We would now like to invite Mali to be followed by Dominica. Mali, you have the floor.
Permettez-moi, avant tout propos, au nom de son Excellence M. Ibrahim Boubacar Keïta, président de la République du Mali, d'adresser mes sincères remerciements à l'Organisation mondiale de la santé pour son leadership à travers son directeur général, Dr Tedros. En dépit d'un contexte sécuritaire particulier, dès l'avènement de la pandémie du Covid-19, le Mali a mis l'accent sur la prévention par l'adoption de mesures barrières sous le leadership du président de la République qui a déjà présidé 2 conseils supérieurs de la défense avec le Covid comme thème central. Le Mali a ainsi élevé la pandémie à un niveau de risque de sécurité majeur pour notre pays. À ce jour, le Mali a enregistré un total de 874 cas confirmés, 52 décès et 512 guéris. Pour les besoins de quarantaine, les hôtels de la place ont été réquisitionnés. Près d'1 millier de nos compatriotes a été rapatriés, testés et placés en quatorzaine dans ces hôtels à travers un corridor humanitaire organisé par le gouvernement du Mali. Le gouvernement du Mali a initié un programme de riposte nationale avec l'appui de l'OMS et de la communauté internationale qui a évalué à environ 52 millions d'euros les besoins de la lutte contre cette pandémie. Nous travaillons en étroite collaboration aussi avec le CDC Afrique pour renforcer la recherche et le suivi des personnes contacts. Madame la Présidente, le programme présidentiel « Un Malien, un masque » a entrepris la distribution gratuite de masques à toutes les populations du Mali. Nous saluons la solidarité et la résilience quotidienne de nos populations dans la lutte contre le coronavirus et nous nous engageons plus que jamais à les appuyer. C'est dans ce cadre que le président de la République a annoncé une ligne de crédit de 750 millions d'euros pour faire face aux conséquences socio-économiques de la pandémie. Madame la Présidente, le Mali, comme l'ensemble des pays africains, a besoin de tests, d'équipements de protection individuelle, de respirateurs. La lutte contre Covid-19 nécessitera les efforts collectifs du monde entier. Cependant, la Covid ne doit pas nous faire oublier notre combat contre le sida, la tuberculose, le paludisme, le diabète et le maintien de nos programmes de vaccination. Enfin, nous appelons l'ensemble des pays membres de l'OMS à se mobiliser pour que Gavi puisse reconstituer complètement ses ressources le 4 juin prochain. Merci pour votre aimable attention.
Merci, Monsieur le Ministre. We are now inviting Dominica to be followed by Nicaragua. Dominica, you have the floor.
Can you hear me?
Yes, please go ahead.
Okay. Madam President, the Commonwealth of Dominica joined other delegations in congratulating you on your election to the chair of the proceeding of the 73rd World Health Assembly. We are confident that you will preside over this assembly with the efficiency and dedication required to make us through this period of global health uncertainty. We thank the Director General for his leadership and his commitment to promoting cooperation among all nations in the face of this global pandemic. Excellencies, ladies and gentlemen, the world as we know, it is facing an unprecedented crisis. COVID-19 has underscored the importance of a united approach by all peoples in the interest of all humanity. Prior to our first case of COVID-19, the government of Dominica, through its Ministry of Health and Wellness, implemented preparedness measures to educate our population of the novel coronavirus. Dominica recorded its first case on March 22nd, 2020. At its peak, Dominica recorded 16 cases of COVID-19, all of whom have since recovered. Our main focus was the prevention and containment of transmission, which was done by aggressive case identification exercises, testing and isolation, together with public health and social measures, all done to avoid an extensive mitigation stage. We continue to recognize the major role played by our healthcare providers and support staff. For this, we pay special tribute to them all. The Commonwealth of Dominica takes this opportunity to express its sincere gratitude to the government and people of the People's Republic of China for its significant contribution of medical supplies and equipment. China remains a true friend to small island developing states in our fight against this pandemic. The Commonwealth of Dominica joins the World Health Organization in recognizing that there is but one China, and the Commonwealth of Dominica is therefore supporting the peaceful reunification of all of China. I would also like to thank Bolivarian Republic of Venezuela and the Republic of Cuba for their much needed assistance and technical support at a time when all countries are battling the same epidemic and face similar challenges. As we continue to share the experience of COVID-19, the world should emerge better prepared for future infectious diseases. This will strengthen not only our national health system, but the World Health Organization as well. It is of paramount importance that we focus on the equitable aspects of healthcare internationally and the achievement of universal health coverage. The importance of striking a balance between maintenance of livelihoods and economic activity while preserving our health status and gains made so far is a delicate one. More so as local economies and borders are reopened in a phased manner. All of this being done based on the scientific evidence available. Let me take this opportunity on behalf of the people of the Commonwealth of Dominica to say special thanks and again commend the World Health Organization for the continued strategic technical support in containing this pandemic. The Government of Dominica applauds the positive efforts of the Director General of the World Health Organization and his staff in providing the leadership, guidance, and coordination in the fight against COVID-19. The Commonwealth of Dominica takes this opportunity to record its deepest condolence to all citizens, families, and friends worldwide who have lost loved ones due to the COVID-19 pandemic, and urge all nations to remain united towards the fight against COVID-19. I thank you.
Thank you, Minister. We would now like to invite Nicaragua to be followed by Tonga. Nicaragua, you have the floor.
Hello.
Yes, we can hear you. Please continue.
Very much. Madam President, receive a warm greeting from the people and government of Nicaragua as we continue to build a society and reconciliation and always help. Exercising a sound in accordance with this reality, formulated a strategy to confront COVID-19, strongly preventive, like all of the interactive family and community health models. The first case of COVID-19 arrived in Nicaragua on 18 March. 2 months before, on 21 January, the Ministry of Health held a press conference informing the population of the impending threat in preventive measures. With the full declaration of public health emergency on 30 January, the government formed an interinstitutional commission to ensure a comprehensive approach. The 9th of February, means supported by the S issued a full protocol to ensure surveillance, detection of suspected and confirmed cases, guaranteed prognosis, medical care, reduction of complications and mortality. The protocol also designated units in 19 hospitals to be specialized, or an increased respiratory symptom preparation and primary clinics nationwide, training of public and private sector personnel, and the acquisition of protective equipment. Nicaragua also has had an experienced adaptation to coming in place. The arrival was prepared for the first case in the 18th of March, with extensive preparation over a period of 2 months. Over 40,000 international travelers completed the 21-day period. Over 350,000 educational house-to-house visits were completed by 98,000 health volunteers.
Honorable Minister, I do apologize. We cannot hear you well at all any longer. I would like to invite.
We also have continuing expanded programs to achieve the Sustainable Development Goals, especially for education coverage.
Thank you very much, Minister. We would now like to invite Tonga to be followed by Kenya. Tonga, you have the floor.
Honorable President and distinguished delegation. First, the Kingdom of Tonga wishes to thank WHO for all support and strong leadership by Director General Dr. Tedros and WHO WIPRO Regional Director Dr. Takashi Kasai. We appreciate the on-site financial and technical support by WHO Country Office, partner coordination and Pacific tailored support provided through Joint Incident Management Team for the Pacific countries in Fiji Sub-Office, Regional Office. Weekly information sessions with ALDI WIPRO, guidelines developed and information shared by WHO headquarters, which was adapted to the Tongan context, and also procurement of items especially for testing kits and PPE. So far, Tonga remains COVID-free, and we are working on a policy document for opening of the border with strict facility-based quarantine, strengthening contact tracing and case management, and engaging the community. Tonga is taking this adversity as a moment to strengthen health system and already established and strengthen one community health center to be a COVID treatment center and strengthen lab capacity to be able to conduct PCR testing. Community support has been tremendous, and community are engaged and are more aware of infection prevention control, including the importance of hand washing. I would like to remind everyone that this is the year of the nurse and the midwife, and my thoughts are with them and frontliners staff supporting those who are in need and saving lives. I am sure together in solidarity we can all get out of this stronger. Finally, I wish to thank WHO and partners for continual support for COVID-19 response and beyond, tailored to the Pacific and small island countries like the Kingdom of Tonga. Thank you, Malo Aupito.
Thank you, Honorable Minister. We are now inviting Kenya to be followed by Sudan. Kenya, you have the floor. We will move directly to Sudan. Sudan, you have the floor to be followed by the Central African Republic. it seems that we will go directly to the Central African Republic, to be followed by Mauritania. You have the floor. We will move to Mauritania, to be followed by Jamaica. Mauritania, if you hear us, please go ahead, you have the floor.
Bonjour.
Bonjour, Votre Excellence. Nous vous écoutons.
وصلى الله على رسوله الكريم. سيدتي الرئيسة، السادة والسيدات الوزراء الصحة، أيها الحضور الكرام، السيد المدير العام لمنظمة الصحة العالمية، أيها الحضور الكرام، السلام عليكم ورحمة الله وبركاته. سيدتي الرئيسة، أود أن أهنئكم على اتخاذكم لإدارة أعمالكم الحالية، تلك الدورة التي تعقد هذه السنة في ظروف استثنائية يواجه فيها العالم بأسره تحديات غير مسبوقة على كل المستويات الصحية والاقتصادية والاجتماعية، انعكست سلبا على جميع ميادين الحياة، خاصة البرامج الدولية للصحة. إنه وضع مهم يتطلب اليقظة الجادة والتضامن بين الجميع من أجل كسب معركة مواجهة جائحة فيروس كورونا المستجد. ولا يفوتني هنا إلا أن نترحم على أرواح آلاف الضحايا الذين مضوا إثر هذه الفاجعة، كما أتقدم عبارات العزاء بالمواساة لآلاف الأسر المرجوعة. كما أغتنم فرصة اجتماعنا هذا من هذا المنبر العليق نشيد بالدور الطلائعي المتميز الذي قدمته القوائم الصحية في كل بقاع العالم، سبيلا إلى تقليل معاناة المصابين والتقليل من الوفيات المحجوزين والتخفيف من آلام المكتوبين قبل وبعد ظهور هذا الوباء. وقد لا يعرفها في هذه الكارثة الوبائية الجديدة من المزايا أنها بينت لنا أن قطاع الصحة والقطاع الاستراتيجي تعرف منظومات اختلالات كبيرة يجب التغلب عليها من أجل تطويره أمام المعضلات الأخرى في مجال الصحة العمومية. لقد قيمت خلال السنوات الماضية بمجهودات جبارة من أجل الوصول إلى التغطية الصحية الشاملة والدفع بمؤشرات الصحة إلى التحسن في بلوغ أهداف المستدامة من 2030، غير أن كل ما تم إنجازه تراجعا بسبب جائحة كوفيد-19. وهنا أود أن أشكر المدير العام لمنظمة الصحة العالمية على الدور الهام الذي تقوم به منظمة الصحة العالمية في مواكبتنا لهذه الجائحة. رئيس العالم، لقد تبنت ولاية الإسلامية الموريتانية الوهلة الأولى الاستراتيجية والطريقة الاستشراقية ومتكاملة بالدقة والكفاءة مما جعلنا عن الانتشار المذهل والحد من المخاطر الناجمة بين صفوف المواطنين. عدد الإصابات في الساعة 81 مع 4 وفيات. هكذا تمكنت بلادنا من الجهات الإسلامية من فخامة رئيس الجمهورية سيد محمد الشيخ غزواني أن تكون في طليعة الدول التي أخذ جولة من التدابير الاحترازية والصارمة على أصول الحصر إنشاء صندوق الحراسي التضامن الاجتماعي فيروس كورونا المستجد. خصصت له الدولة عامة وشاركت في تمويلات الشعب سخائي قرية واسعة، وتصرف هذه المبالغ باقتناء حاجيات البلد من الأدوية والمعدات والتجهيزات الطبية بمواجهة الوباء، وما يستفيد منها عشرات من الأسر المحتاجة لتوفير مواد.
Honorable Minister, could you please conclude?
إلى تحمل كما وضع الوطني للرد السريع تضمنت محاور الجوانب المتعلقة بمكافحة الفيروس.
Honorable Minister, we apologize, but you have exceeded your time limit. We would like to ask you to conclude. Thank you very much. We appreciate your understanding. We would like to invite Central African Republic to be followed by Cameroon. Central African Republic, you have the floor. We will try once again Cameroon. Please, if you can hear us, you have the floor.
Madam President, the Republic of Cameroon has the honor to speak on behalf of the African Group in Geneva at this historic virtual session of the 73rd World Health Assembly. The African Group acknowledges the efforts of the European Union and its member states in proposing this resolution and hereby confirms our wish to join as co-sponsors. The African Group believes that the resolution is timely and addresses pertinent issues which member states are currently dealing with as they respond to the pandemic. Over and above that, the resolution symbolizes the outcome of multilateralism and unity of purpose to this common enemy. Madam President, while the COVID-19 pandemic is primarily a health crisis, it has also had far-reaching implications on all sectors and spheres. The African Group acknowledges that if drastic preventive and control measures are not taken urgently, the economic, social, and even security consequences of the epidemic could be felt on a very large scale. Africa is particularly at risk, given its relatively fragile health system, concomitant epidemics, limited resources, and high population mobility, among other vulnerabilities. Given these challenges, many of our countries follow the global trends and impose lockdowns to varying degrees. Approximately 70% of our population rely on subsistence livelihoods, and this therefore calls for adaptation of the lockdowns to local realities, challenges, resources, and strengths. To caution the most vulnerable from the effects of these lockdowns, our respective governments have provided targeted assistance, including through direct cash transfers and delivery of care packages and food parcels, for example. In order to coordinate our continental response, the African Union adopted the Africa Joint Continental Strategy for COVID-19 with the overall aim of limiting transmission of the virus and minimizing harm through the use of an all-of-government approach. These efforts are being led by the Africa CDC, working in close collaboration with African Union member states, the WHO regional offices, and other stakeholders. Madam President, the COVID-19 pandemic has shown that the world is safer and more secure from global health threats caused by infectious diseases when all countries are able to prevent or mitigate the impact of outbreaks, rapidly detect outbreaks when they occur, and respond effectively to limit their spread. At the moment, there is no vaccine or proven treatment available for COVID-19. As such, public health interventions will continue to be an important tool to reduce transmission and prevent further spread of COVID-19. Similarly, transparency and access to information are regularly done by the WHO with member states, including through regular briefings, remains key to the effectiveness of the global strategy against the pandemic. With regards to research and development, the African Group welcomes the various initiatives aimed at ensuring equitable access to new COVID-19 diagnostics, treatments, and vaccines. We join calls in support of developing mechanisms to ensure that when a safe and effective vaccine is developed, it is produced rapidly at scale and made available for all people in all countries at the cost that everyone can afford. History has taught us as witness with disease such as HIV and Ebola, for example, that we cannot afford to leave anyone behind as a result of unequal access to treatment. In this regard, we urge member states and the private sector to work together to facilitate the transfer of technology and know-how for medicines, vaccines, diagnostics, and other commodities that will allow us to meet global demand. No one country can do this alone. Where possible, member states should fully utilize the flexibility contained in the TRIPS agreement and the Doha Declaration to safeguard public health. Madam President, several African countries stepped into the COVID-19 pandemic under a high burden, which offers them limited room for fiscal maneuver to overcome the economic impact of the pandemic. We therefore call for a global coordinated response to the debt burden by providing debt relief, including debt cancellation coupled with emergency
Ambassador,
grants.
please conclude.
In conclusion, Madam Chair, the African Group in Geneva wishes to reaffirm our confidence in the WHO under the leadership of its Director General, Dr. Tedros Adhanom Ghebreyesus, in the execution of its mandate as the United Nations Lead Technical Agency for Global Health Governance and Public Health Emergency Response. We also reaffirm our commitment.
Thank you, Ambassador, for your statement. We would now like to invite...
Thank you, Madam President.
Thank you, Ambassador. We would now like to invite St. Vincent. St. Vincent, you have the floor.
Can you hear me?
Yes, please. Please proceed.
Delegates of the World Health Assembly, greetings from St. Vincent and the Grenadines. The world is dealing with the most serious public health challenge in living memory. The COVID-19 pandemic has basically affected every corner of the globe with impacts on health and the economy. It is affecting lives and livelihoods. I never thought that I would see pictures of an empty JFK airport, the UK in lockdown, and health systems the world over under siege. But that became our reality in the 21st century. Right now, we are all basically marooned in our own countries. This pandemic has taught us that we don't have a developing world and a developed world or anything like that. We have one world, and we are all in it together. St. Vincent and the Grenadines has not had any cases of COVID-19 for over 14 days since May 3rd. We have had 17 confirmed cases overall, of which 14 are recovered and 3 are active. There have been no deaths and no health worker has been infected. In response to COVID-19, St. Vincent and the Grenadines implemented a raft of social and public health measures to minimize the spread of the disease. It is impossible to recite all these measures in a 2-minute statement. However, our strategy can be summed up in a few short lines. 1, finding cases and isolating them. 2, taking special precautions with high-risk groups such as travelers and exposed persons because they might be cases. 3, providing appropriate clinical care. 4, applying general and specific infection control and prevention measures as guided by the science. Fighting COVID-19 is like fighting a fire. We must go after it aggressively and snuff it out. We never had to resort to full-scale lockdown. We didn't impose curfews or close our borders and airports. Naturally, travel activity was curtailed by the suspension of commercial flights. We built our response on the foundation of public trust through advisories and appropriate actions. We have been managing risk with the aim of maximizing the health, freedom, rights, economic, social, and other benefits to the population. Our response was affected by the disruption of supply chains and trade restrictions. It took us 2.5 months to get a PCR machine, and even the International Atomic Energy Agency, for all its good intentions and explosive might, seemed powerless to help us on this matter. This raises many certain questions. Fortunately, we were able to do tests at the Caribbean Public Health Lab located in a nearby country using regional security aircraft for transportation of samples. We had to deal with complex matters such as the repatriation of Vincentian cruise ship employees who were abroad.
Honorable Minister, we would kindly ask you to conclude.
We thank God for everyone who came to our assistance, our development partners, the Caribbean Development Bank, the International Monetary Fund, the World Bank, and the United Arab Emirates stood by us. Cuba sent doctors and nurses for our isolation center. Venezuela provided supplies and rapid test kits, even though that country is still being subjected to sanctions and political adventurism at the time of COVID-19. Imagine that. Taiwan has emerged as a shining example to the world in terms of response to COVID-19 and has provided assistance to many countries, including St. Vincent and the Grenadines. But it is still locked out of the World Health Assembly. Imagine that. This matter must be addressed and resolved in a satisfactory
Honorable
manner.
Minister, we would kindly ask you to conclude.
Taiwan can help. The Director General of the World Health Organization is fond of saying that the antidote to COVID-19 is national unity, global solidarity, and the human spirit. I agree with him. We are in tempestuous seas, but we could summon to our assistance the following refrain from a popular song of faith in our country. With Christ in our vessel, we could smile at the storm. We will beat the coronavirus pandemic together. We are looking forward to the development of vaccines.
Thank you very much, Honorable Minister. We would now like to invite Jamaica to be followed by Tuvalu. Jamaica, you have the floor.
Good morning. On behalf under the guidance of the WHO, Jamaica's early response to the COVID-19 epidemic and our proactive approach to preventing, detecting, containing, and responding have resulted in significant slowing down of the disease in the country. We have, in fact, up to this point, flattened our curve. The strengthening of Jamaica's capacities under the International Health Regulations 2005 has been the background against which the country has responded. Our success so far has centered around an early education program, enhanced surveillance, early institutional restrictions, early response to perceived threats, and a rapid containment exercise. The resulting increased public awareness and early detection of cases and our primary healthcare establishment enabled our ability to mobilize our response teams into communities for case investigation and contact tracing. Our experience with contact tracing, fast responses to public health emergencies such as measles and malaria have resulted in the continued elimination of diseases from our country. We can say that it is our early implementation of these measures from the detection of our first imported case that have had positive results. As a country, we have had to take drastic decisions to shut down sections of the island in order to conduct investigations and to contain this disease. The slowing down has also allowed time for the building of additional capacity in the health sector. COVID wards have been established and healthcare workers have been sensitized to the necessary infection prevention and control measures. We have increased the capacity for high dependency and mechanical ventilator support and care, as well as improved our inventory management of personal protective equipment. There has been significant strengthening of the lab and increase in the capacity to collect samples through the parishes. We want to thank the Pan American Health Organization and the WHO for the assistance that it has provided and continues to provide to Jamaica in this area. The acquisition of immunity, whether through vaccine or through exposure of the population, is a main consideration when contemplating the lifting of restrictions that will result in increased numbers of persons becoming infected with the virus. There are several uncertainties around the development of it. In conclusion, as we move forward, I would like to recognize and thank the hard-working healthcare workers of Jamaica, while recognizing that this year, 2020, is the year of the nurse and midwife. Indeed, frontline workers worldwide are contributing tremendously in managing this pandemic. We salute these persons, Madam President, who are our true heroes. Thank you very much.
Thank you very much, Honorable Minister. We would now like to invite Tuvalu to be followed by the Central African Republic. Tuvalu, you have the floor.
Director General, Dr. Tedros Adhanom, Excellency, ladies and gentlemen, I'm pleased to give this statement on behalf of Tuvalu. As of today, Tuvalu remains COVID-19 free. Our thoughts today are with our nations that have and still continue to fight the spread of COVID-19, and our prayers with the families of those who have lost loved ones to this novel virus. On this International Day of Nurses and Midwives, we thank you to those at the front line of international effort to minimize its spread, especially health workers around the globe. Since the end of January, with our Prime Minister at the helm, Tuvalu has been preparing for the possibility of COVID-19 reaching our beautiful shores. We have been working hard to strengthen our system so that we are ready. This has included mobilizing multi-sectoral coordination through a national planning and response task force and 7 subcommittees, improve surveillance and risk assessment, prepare our laboratory to test for the virus, maintain essential clinical management and healthcare services for our people, strengthen our infection prevention and control mechanisms, institute non-pharmaceutical public health measures, and disseminate risk communication via email, radio, TV, social media, and national press conference to keep our community informed, work with partners to investigate safe modes of transportations for medical supplies and operational logistics. COVID-19 is a wake-up call to developed countries and developing countries of the need to investigate, including training human resources for public health. Tuvalu support global research in findings and producing safe vaccine that will assist our recovery to becoming a COVID-free, 19-free world again. Thank you to the World Health Organization for your leadership and support. We know this has been an immense challenge. We especially thank to Dr. Kasai, Western Pacific Regional Director, for rallying your team behind us.
Thank you, Minister. I now give the floor to Central African Republic, to be followed by Iraq. Central African Republic, you have the floor. Okay, so we'll need to come back to Central African Republic. I now give the floor to Iraq, to be followed by Palestine. Iraq, you have the floor. Okay, so we will need to come back to Iraq. I now give the floor to Palestine. Palestine, you have the floor.
الأوضاع الصحية للسكان في دولة فلسطين. لا يزال النظام الصحي الفلسطيني يواجه تحديات جسيمة في ظل الاحتلال الإسرائيلي وممارساته وانعكاسات ذلك على صحة السكان الفلسطينيين. هناك أزمة مالية خانقة، حصار اقتصادي وسياسي، إغلاقات للمدن والقرى والمخيمات، هناك تقسيم للوطن الفلسطيني إلى مناطق مجزوءة، حواجز احتلالية، جدار فصل عنصري، استيطان متزايد في قلب الأراضي الفلسطينية، واعتداءات المستوطنين المتكرر على السكان الفلسطينيين الآمنين وممتلكاتهم. عدد سكان الفلسطينيين في كافة أنحاء العالم يقدر بحوالي 12,700,000 نسمة، منهم 4,800,000 نسمة يقطنون على أراضي دولة فلسطين، أي ما نسبته 38.4%. ويتكون النظام الصحي الفلسطيني من 5 قطاعات أساسية: وزارة الصحة الفلسطينية، وكالة الغوث وتشغيل اللاجئين، الخدمات العسكرية، القطاع الخاص والمنظمات الأهلية. أما بالنسبة إلى وباء كوفيد-19 في فلسطين فإن كافة الخدمات المتعلقة في الصحة العامة ومن ضمنها وباء كوفيد-19 يتم تقديمه بشكل مجاني لكافة المواطنين وعلى نفقة الدولة دون تحميلهم أي أعباء مادية استنادا إلى قانون الصحة العامة رقم 20 لعام 2004. وقد تم تسجيل 548 حالة مثبتة مخبريا في دولة فلسطين، أي في الضفة الغربية، قطاع غزة ومحافظة القدس. ومن هؤلاء 75% من الحالات كان مصدر عدوتها إما عمال الذين يعملون داخل الخط الأخضر أو مخالطيهم. وقد كان 77% من الحالات قد شفيت وأخرجت إلى الحجر المنزلي لتاريخه. وقد تم استحداث البروتوكول العلاجي الفلسطيني بالإضافة إلى العديد من التعاميم الفنية والخاصة بالتعامل مع هذا الوباء. أما بالنسبة إلى الخدمات الصحية فقد قمنا بالاستمرار بتقديم الخدمات الصحية الأساسية والطارئة خلال فترة وباء كوفيد، مثل المطاعيم، أقسام الولادة، الطوارئ والأمراض المزمنة. تجمعنا مع مكتب منظمة الصحة العالمية والشركاء الدوليين علاقات مميزة، وهناك تعاون وتنسيق كامل معهم إما جماعة أو ثنائيا. إن دولة فلسطين لا تزال ترزح تحت الاحتلال وممارساته، ومن هنا ندعو منظمة الصحة العالمية والدول الأعضاء إلى الاستمرار في دعم دولة فلسطين لتتمكن من الاستمرار في تقديم خدماتها إلى المواطنين الفلسطينيين والعمل على تطوير خدماتها.
Your Excellency, we would kindly ask you to conclude, please. Thank you very much. We would now like to invite Gavi, the Vaccine Alliance, to take the floor. Gavi, you have the floor, please.
Thank you, Chair. The COVID-19 pandemic threatens years of progress in primary health care. In Gavi countries, over 70% of the target vaccine introductions and campaigns for 2020 have been delayed, suspended, or are at risk. We are faced with an emergence of other vaccine-preventable disease outbreaks, such as measles, yellow fever, and polio. The pandemic will disproportionately impact women, vulnerable, marginalized communities, as well as zero-dose children, those who do not receive any routine vaccine. As an alliance built on the principle of equity, Gavi is taking urgent action to support countries to maintain and restore their immunization programs. We are also part of the WHO ACT Accelerator, co-leading the work to achieve global access to COVID-19 vaccines. Gavi has two specific asks for you. First, to support and call for a fully funded Gavi replenishment on June 4th. This will be critical to our work with countries to immunize children, implement the Immunization Agenda 2030, save lives, reduce poverty, and protect the world against the threats of epidemics. Second, to support global access to COVID-19 vaccines. COVID is a global problem, and we need a global solution. A vaccine is the best hope for the world to get back to some semblance of normalcy. We need to get the best science in the world for vaccines and make sure those vaccines are available to everyone, for no one is protected until everyone is. Finally, Gavi would like to express profound appreciation for the works of health workers, nurses, and midwives for their extraordinary dedication and service to humanity. Thank you.
Thank you for your intervention. I would like to give floor now to the International Federation of the Societies of the Red Cross and Red Crescent, to be followed by the International Atomic Energy Agency. IFRC, you have the floor.
I'm a nurse and a public health delegate with the Australian Red Cross, and I'm speaking today as a member of a global network of 14 million volunteers and 500,000 staff from across 192 national Red Cross, Red Crescent societies. COVID-19 poses the greatest threat to our collective health and well-being. The work that Red Cross, Red Crescent does every day to support programs in maternal and child health, vaccinations, HIV, malaria, the disabled, and accessing clean water and sanitation are threatened by this global pandemic. We know people living in poverty don't have a stockpile of food or money to help them through any form of lockdown. We know that it will highlight and exacerbate inequalities in all contexts. Those that were vulnerable, marginalised, excluded and stigmatised before this pandemic will disproportionately feel the force of its effects now and well into the future. Collectively, we must do all we can to protect those most vulnerable, and we must ensure that we deliver on our promise of health for all. We must also look to the indirect consequences of this outbreak on our already overwhelmed health systems. For many, it's their only point of contact with life-saving health and routine care services. People will still require their antiretroviral medications, food supplies must continue to flow, expectant mothers must have a safe place to give birth, malnourished children still need access to feeding centres and support, and communities will still need to access safe water and sanitation. We therefore call on states to do the following: continue to invest in essential humanitarian work and fragile health systems, a collective global commitment to designate and ensure access to everyone, irrespective of where they are in the world, in any future vaccines, testing and treatments for COVID-19, and ensure a duty of care for all those public health professionals, first responders, community health workers and volunteers responding to this outbreak. Thank you.
Thank you very much. I would now like to invite the International Atomic Energy Agency to be followed by ITU. IAEA, you have the floor.
Distinguished President, Director General, the IAEA is an important partner for countries battling the COVID-19 pandemic. We have focused on providing practical guidance and equipment for detecting the virus. We are supplying nuclear-derived diagnostic kits and accessories to 242 laboratories in some 120 countries. We produced webinars and videos for healthcare and laboratory professionals, including on sample collection and processing. We have received generous contributions from member states. The relevant cooperation project is now the biggest in the history of the IAEA. Our long-standing partnerships with WHO and FAO have proved immensely valuable. We are actively participating in the COVID-19 crisis management team. At the next IAEA Board of Governors meeting in June, I will set out my ideas on how the agency can best support member states in responding comprehensively to future pandemics. More generally, let me note that the IAEA is very active in the human health field, helping member states to address challenges such as cancer, cardiovascular diseases, and malnutrition. Our particular focus is on radiotherapy and nuclear medicine. We greatly value our cooperation with the WHO in all these areas. Thank you.
Thank you, Your Excellency. We would now like to invite ITU to be followed by UNOPS. ITU, you have the floor.
Congratulate WHO Health Assembly. As the UN Specialized Agency for ICT Technologies and Services, and a longtime partner of WHO, ITU is committed to continuing to leverage ICT technologies to help defeat COVID-19 and make the world safer, stronger, and more connected. Never before has digital health and ICT technologies such as artificial intelligence, cloud computing, Internet of Things, 5G, and others being so fundamental to economies and societies everywhere. Now, more than ever, universal health coverage will be possible only when everybody is connected. I'm confident we can use the momentum around COVID-19 to bring digital health solutions to billions and transform today's digital revolution into a development revolution for all.
Thank you, ITU. We would now like to invite UNOPS to be followed by UNCTAD. UNOPS, you have the floor.
Pandemic and measures to contain it are hitting the poorest and most vulnerable the hardest, risking the progress made on nutrition and achieving the Sustainable Development Goals. The pandemic is already increasing hunger and malnutrition because for many of the 61 member countries, a day without work means no income and no access to nutritious food. Many are pushed deeper into poverty and essential health and nutrition services are disrupted. Nutrition is key to build immunity, protect against illness and infection, support recovery and build resilience. Malnutrition is an underlying cause of almost half of child deaths and negatively impacts children's cognitive and physical development. I call on all stakeholders to ensure that malnutrition is adequately addressed in the COVID response and recovery through a multi-stakeholder approach.
Thank you very much, Your Excellency. We would now like to call UNCTAD to be followed by UNAIDS. UNCTAD, you have the floor.
No country has been spared by COVID-19. Beyond the tragic death toll, the pandemic has cut millions of jobs and livelihoods, especially in developing countries with fewer safety nets and resources. Global production and trade have plummeted in the wake of unprecedented confinement measures. We expect global trade to fall by a staggering 27% in the second quarter. This crisis has shown that we need better trade, not only as an engine of economic growth, but also to tackle shortages of medical supplies and food. Solidarity and cooperation are crucial to find solutions to this crisis and overcome the shockwaves on debt, food and migration, particularly in the developing world. Let us use this opportunity to craft development strategies for a better recovery, which is more fair, more resilient, and protects our environment.
Thank you, Your Excellency. We would now like to invite UNAIDS to be followed by UNFPA. UNAIDS, you have the floor.
President and ministers at the Assembly, Director General, my brother Tedros, distinguished delegates, I speak on behalf of the joint United Nations program on HIV/AIDS. As we have seen with HIV, and as we now see with COVID-19, epidemics affect everyone, but they do not affect everyone equally. To fight COVID, we have to fight inequalities because pandemics feed on and widen inequalities. That is why I'm backing calls by over 100 current and former world leaders and global experts to unite behind a people's vaccine. Together, we want all leaders to guarantee that when a safe and effective vaccine is developed, it is produced rapidly at scale and made available for all people in all countries free of charge. We unite behind a people's vaccine to protect all of humanity.
Thank you very much, Your Excellency. We will now go back to our member states, and we invite Central African Republic to take the floor, to be followed by Nicaragua. Central African Republic, you have the floor, please.
Ils attendent. Madame la Présidente, Messieurs les vice-présidents, Messieurs, Mesdames, ministres de la Santé et délégués, Monsieur le directeur général, la République centrafricaine s'aligne sur la déclaration faite par le Congo au nom des États africains membres de l'OMS et souhaite par la présente renforcer celle-ci. Au nom du gouvernement et du peuple centrafricain, je félicite Monsieur le directeur général de l'OMS pour un leadership proactif. Comme vous le savez, la RCA est un pays à faible revenu, enclavé et marqué par plusieurs décennies de conflits politico-militaires et d'instabilité, ayant entraîné l'effondrement du système de santé avec comme conséquence le deuxième taux de mortalité maternelle le plus élevé du monde, ainsi que des flambées épidémiques auxquelles les enfants payent un lourd tribut. À cela s'ajoutent des frontières poreuses, de transmission transfrontalière. Dans ce contexte, l'extrême-19 est une menace de trop pour la santé de la mère et de l'enfant centrafricain. Depuis la détection du premier cas de Covid-19 en Centrafrique le 14 mars dernier, la mise en train de la riposte sous la haute direction du président de la République a fait que notre pays a su résister à un choc initial majeur. Toutefois, la République africaine se trouve à un tournant de l'épidémie de Covid qui se caractérise par une augmentation rapide du nombre de cas importés et autochtones. En date du 18 mai 2020, nous avons enregistré 366 cas confirmés, 13 guéris et 0 décès, alors que nous étions à 12 cas il y a environ un mois. Avec une capacité très limitée de prise en charge, il nous faut dans cette progression fulgurante de l'épidémie et éviter le pire. Mais notre élan de riposte risque de s'arrêter à la fin de ce mois de mai. Notre réserve en test de dépistage s'épuise dans ce monde. C'est ici l'occasion de lancer un cri de détresse à l'OMS et toutes les bonnes volontés. Dans cette optique, la RCA félicite l'OMS pour mettre en place un grand nombre de partenaires, la plateforme pour l'approvisionnement des intrants essentiels pour la lutte contre la COVID-19. Néanmoins, cela a pris trop de temps et jusqu'à présent, nous n'avons encore reçu aucun de ces intrants. Et sans les donations d'une fondation privée chinoise, nous n'aurions pas pu mener la réponse comme nous l'avons fait. Je prie donc l'OMS et les partenaires de se montrer plus attentifs et plus vigilants aux conditions des pays fragiles dans cette lutte. En outre, que des efforts soient consentis pour adapter les procédures de financement aux situations d'urgence. Trop souvent, les annonces d'aide et la réalisation de ces dernières sont trop décalées dans le temps. La façon de donner vaut mieux que ce que l'on donne. Tout en appliquant la solidarité mondiale sans précédent contre la COVID-19. Je voudrais remercier particulièrement
Your Excellency, we would kindly ask you to
la
conclude.
célérité et la flexibilité de leur contribution, notamment l'OMS, l'UNICEF. La mission intégrée, l'Institut Pasteur, la Croix-Rouge, l'Union européenne, l'Agence de coopération italienne, la Banque mondiale et la République populaire de Chine. L'appui de la Chine a été crucial par la livraison des tests et des équipements qui ont permis de lancer une grande campagne sur l'état du territoire. Enfin, Monsieur le Président, la RCA réitère au principe d'une seule Chine. Merci de votre attention.
Thank you, Your Excellency. I apologize for announcing Nicaragua. We already heard their statements. Now we go to Benin. Benin, you have the floor.
Madame la Présidente, Mesdames et Messieurs, le Bénin, à l'instar des autres pays, est touché par la pandémie de la COVID-19 depuis le 16 mars 2020. Pour faire face à cette pandémie, le Bénin a adopté les mesures barrières, y compris le port obligatoire de masques et les mesures de limitation de mouvement. Un cordon sanitaire isolant la capitale des principales agglomérations qui l'entourent a été mis en place sur 40 jours. Une reprise progressive des activités est apportée depuis le 11 mai 2020. Le peuple béninois reste engagé côté de son gouvernement pour la poursuite de la riposte et exprime son soutien aux actions de l'OMS et de son directeur général. Le Bénin souligne l'importance de poursuivre et d'étendre au plus grand nombre de personnes l'accès au diagnostic, notamment par une réflexion plus approfondie sur l'utilisation des tests de diagnostic rapide dans les régions où la disponibilité des laboratoires est problématique. Nous attirons également l'attention de la communauté internationale sur la nécessité d'œuvrer en vue de faciliter l'accès aux médicaments et autres produits et équipements médicaux pour la riposte à la COVID-19. Le Bénin remercie l'OMS et les autres partenaires techniques et financiers pour l'assistance très appréciée accordée au Bénin dans la riposte à la COVID-19 et les exhorte à appuyer les pays en développement dans leurs efforts et initiatives visant à renforcer leur système de santé. Aussi, le Bénin sollicite-t-il le maintien de l'appui extérieur aux actions de riposte contre la pandémie, y compris la mitigation des impacts socio-économiques. Je vous remercie.
Merci, Monsieur le Ministre. We are now continuing with international organizations. I would like to invite UNFPA to be followed by International Organization for Migration. UNFPA, you have the floor.
Colleagues, friends, in welcoming this World Health Assembly's focus on COVID-19, UNFPA wishes to express alarm about the pandemic's impact upon women and girls. Access to life-saving sexual and reproductive health services is under threat as resources are diverted and global supply chains are disrupted. Reports of sexual and gender-based violence are sharply increasing, just as prevention and response services are strained. Nevertheless, we are rising to this extraordinary challenge, including in humanitarian situations. Our support to countries with weak health systems helps maintain sexual and reproductive health information and services for women and young people. It helps prevent and respond to sexual and gender-based violence, including a halt to child marriages and female genital mutilation. And we are assisting with protection of health workers, including midwives, so no woman dies while giving life. With such sustained investments in the face of the pandemic, we can indeed build back better and attain health for all and all the Sustainable Development Goals. UNFPA stands proudly with the World Health Organization and all our partners, with governments, and with the people we serve on the ground in over 150 locations, confident that after COVID-19, we emerge stronger and together deliver a healthier future for women and girls and everyone everywhere.
Thank you for your patience. This morning when we began our session, I proposed a very ambitious course of action. There were many delegates who took the floor and made statements. However, given the hour, I propose that we suspend this item and take any further speakers tomorrow. Tomorrow we will also consider the draft resolution. However, before closing the session for today, I would like to now give the floor to those delegations that requested to exercise their right of reply earlier in the day, or would like to make such requests now. I would like to kindly recall my earlier requests that in delivering a right of reply, delegations be as brief as possible, taking into account that at this meeting, interventions themselves are limited to 2 minutes. If delegations could kindly interrupt the word brief relative to the time allotted for interventions, I would greatly appreciate that. And finally, if there are subsequent requests by delegations for additional rights of reply concerning the same matter as previous replies, may I kindly request delegations to limit such statements to 30 seconds or less. Again, I hope delegations will understand that these requests are made in our common interests in the good order of our proceedings. I shall now give the floor to China. China, you have the floor now, please.
Hello, Chair. This is our colleague. That's right. Okay.
主席女士，中国代表团大会议事规则第57条，行使裁决权，经协商，各方决定本次执行大会不讨论这个提案，以免干扰大会的进行。但是遗憾的是，台湾作战考试严重违反联合国和这个相关的，破坏全球团结抗疫的努力。中方对此严正抗议反对。中方重申，对中国台湾参与国际组织活动问题，必须在一个中国的原则下，通过两岸协商做出合情合理的安排。台湾当局拒不接受一中原则，其参加世卫大会的政治基础已经不复存在。疫情发生以来，通过两岸渠道与中方与世卫组织做出的安排，台湾地区一直能够获得相关信息，参与必要的 技术活动。所谓台湾地区与国际防疫体系缺口，完全是政治炒作。真实目的就是在国际上制造两个中国或一中一台，但是这样的图谋绝不可能得逞。中国方奉劝有关国家把精力更多在疫情保护和拯救生命上，对本国人民和国际社会承担起应尽的责任。抗疫对抗分歧不得人心，团结合作才是战胜疫情的唯一出路。谢谢。
I now give the floor to the United States.
Thank you, Madam President. Given the lateness of the matter, I will briefly consider several U.S. concerns and will submit the entirety of our statement for the record. Regarding the United States again asks that the forum remain with technical exchanges of information related to public health and not one used for political agenda. However, given the earlier statement by Iran, the United States will exercise its right of reply. The United States has and continues to offer humanitarian assistance to the Iranian people to help address the coronavirus outbreak. The United States maintains broad authorizations, exemptions, and exceptions that allow for the sale of food, agricultural commodities, medicine, and medical devices by U.S. personnel working in the United States to Iran, and similar exceptions apply for foreign persons providing aid. Our sanctions are not an obstacle to providing humanitarian aid to Iran. Regarding Cuba's statement, the United States wishes to call out Cuba's appalling and egregious choice of words. Their reference to genocide is deeply offensive and dismissive to the victims of actual genocides that have occurred. For decades, the U.S. embargo on Cuba included broad exemptions and authorizations that permitted the sale and donation of agricultural products, medicine, medical devices, and other humanitarian supplies with billions of dollars of goods authorized for export to Cuba since 1992. Under this administration, all applications for licenses to send medical goods to Cuba have been approved. In 2019 alone, the United States exported at least $3.7 million of medicines and medical products. Regarding Syria's statement, the U.S. Syria sanctions program does not target the provision of humanitarian goods, including medicine, medical supplies, and food to Syria. The United States already provides exemptions and licenses for humanitarian aid and medical supplies to reach the Syrian people and has done so for many years, including U.S.-funded humanitarian aid to regime-held areas. The United States so far has provided more than $31 million in humanitarian assistance to Syria to counter COVID-19. This comes in addition to more than $10.6 billion the United States has provided in humanitarian support to Syria since the conflict began. Finally, in conclusion, Madam Chair, the COVID-19 pandemic makes clear the urgency of engaging all public health authorities and the value of exchanging lessons learned in real time. As the WHO is charged with protecting and advancing global health, it is essential to include these authorities, especially those with first-hand experience in combating COVID-19. We ask the WHO to exercise leadership, independence, and inclusivity, and fully involve Taiwan in the global COVID-19 response, including Taiwan's participation as an observer in the resumed 73rd World Health Assembly session. Thank you.
Thank you. Having come to the end of the session for today, I would like to thank you for joining us and remind you that the next plenary will reconvene tomorrow at 12 Central European Time. Thank you.